everyone. A very good evening to one and all present here. My name is Priyanshi Sharma, and I am your host for today's event. On behalf of organizing committee, I welcome you all to one of its kind first Global Women for Oncology Summit, GLOWS. I thank all the faculty members and dear participants who has joined from all over the world for on this on this virtual platform today. Let us begin this summit, and I would like to welcome the chair of the organizing committee, Dr. Jyoti Bajpai. She is an extremely passionate towards workforce equity, especially gender related, and she is currently professor of medical oncology, Tata Memorial Hospital, Mumbai. She is also a co-member of ESMO, of Women for Oncology Committee, founder General Secretary, Immuno-Oncology Society of India. Thank you. Over to you, Dr. Bajpai.
So, thank you very much, Priyanshi, for this kind words of introduction to my humble self as well as the summit. And Excellencies, Honorable Chief Guest, Mr. Fadnavis, the Deputy Chief Minister of the state, Guest of Honors, the Director, Tata Memorial Hospital, Dr. Badve, and Director, ACTREC, Dr. Sudeep Gupta, our esteemed orator, none other than ESMO President, Dr. Solange Peters, ESMO Women for Oncology Chair Pilar Garrido, other distinguished speakers from both sides of Atlantics, national guest faculties, ladies and gentlemen. Thank you so much for your wholehearted support for the first of its kind of Global Women for Oncology Summit. We are calling it as GLOWS. On behalf of my entire organizing committee, it is an extreme pleasure and privilege for me, and I am actually overwhelmed to open this first summit. We should see this forum as the most timely opportunity to secure and accelerate much needed progress, build consensus, and share the best practices that allow us to actually spread this momentum for gender equity in oncology, which is much, much needed. This is a tipping point moment, and it is integral to the ambition of the agenda for sustainable development for all, irrespective of their gender, their origin, or anything else. I urge this summit stakeholders and supporters to find answers, to pull together diverse views in a mutually respectful process, and also to agree to conclusions that show that we are here especially to invest and support the right cause. This is a welcome development towards a larger goal of gender equity in oncology globally, and I welcome you all to witness these moments while we will discuss the progress during the summit. So thank you everyone. A very, very warm welcome to all of you. And I'll hand over again to Priyanshi to announce for the session one. Over to you.
Thank you, Dr. Bajpai. Very nice to hear you. We now move on to an interesting segment of this summit. Let's move on to the first panel discussion, and I would like to invite a senior medical oncologist at Lilavati Hospital, Mumbai, Dr. B.K. Smriti, a renowned senior oncologist at Shri Aurobindo Institute in Indore, Dr. Prakash Chatalkar, and a renowned senior oncologist and currently chairman, Oncology Collegium, Narayana Health, Head, Pediatric Oncology in BMT SRCC Children Hospital, Mumbai, Dr. Purna Kurkure. Now I will request Dr. Chatalkar to introduce the topic and moderator. Thank you. Over to you, Dr. Chatalkar.
If there is some technical issue with Dr. Chitalkar, then we can request Dr. Smriti to please introduce Dr. Dr. Jyoti Vatva.
Hello.
Hello, yeah, madam, please.
Yeah, I now request Dr. Jyoti Vatva as to join the panel for the panel discussion, and which is going to be, she is the senior director of medical oncology at the Medanta Institute in Gurgaon. I request her to, moderate the panel and call on the panelists to join in for a very heated discussion on various matters. So, Dr. Jyoti Vadva.
Thank you, madam. So, namaste and good evening to you all, and good morning to some, because I'm aware there are experts joining us today for this meeting globally. So, I again welcome you all to the first session of the first Global Women for Oncology Summit called GLOWS. And I must compliment Dr. Jyoti Bajpai, my namesake, for taking the lead, and Indian Society of Medical and Pediatric Oncology, and many senior oncologists in India and the international faculty for wholeheartedly supporting this venture. I would be moderating the panel, and I have many esteemed panelists joining us today from different parts of the country. So we have 8 panelists, and let me invite you all. Dr. Smita Kayal, she's from Jipmer, Puducherry. Dr. Bhavna Parekh, she is a senior medical oncologist from Mumbai. Dr. Sevanti Limay, she is also from Mumbai, again, a precision oncologist and a medical oncologist. Dr. Anita Ramesh from Chennai, she is a senior consultant medical and pediatric oncologist. Dr. Manisha Singh, a medical oncologist and head of Department of Medical Oncologist from Patna. Dr. Roshni Bhagwat from Jabalpur. Dr. Deepti Rani Samanta is joining us from Cuttack, and Dr. Meenu Walia, a medical oncologist again from Max Institute, joining us from Delhi. So I hope all the panelists have joined in. Okay, so we shall be discussing the regional challenges for women oncologists in India. And I'm happy to see that we have representation from almost all parts of the country. So let me begin. Do you feel that the oncology climate in India is, I don't have any formal slides, so we'll keep it informal. We'll keep it a heart-to-heart discussion and talk. So please feel free to pitch in your views as you feel necessary. So do you feel that the oncology climate in India is gender equal or gender neutral? So let me start with you, Dr. Manisha. Dr. Manisha from Patna.
Yeah, Sector, can you hear me?
Yes, yes.
Yeah, a very good afternoon to all of you. So thank you at the outset, Jyoti, for the invite. And this is a very interesting session, I suppose. So this is a very pertinent question that the gender bias regarding treatment of oncology. And definitely it is yes. I think when I joined as an oncologist, the first question that came to me that why are you opting to go for this subject? It's a thankless subject. Perhaps you can opt to go for any other subject, which will be more challenging and which will give you more of, credit. So that was the scenario decades back when I was, as a budding oncologist in my field. And when I joined in this field, there was definitely, the seniors, they used to promote the boys more because they had a feeling that the girls, it's an unnecessary, to value these girls because probably tomorrow they will get married, they will have children and they will have families, they will excuses. So this was the scenario in which, I grew up and my career started. And I felt at times that, boys were valued more rather than girls. In fact, patient class also at times I felt, that they are little more happier to be seen by senior male doctors rather than the female. But during, the passing of time, gradually when the scenario changed and I became a senior doctor, and in fact, today I am heading my institute and I'm the medical director there, what I feel that definitely, it's like walking on a tightrope when you're handling both the situation, being a female doctor and also being an oncologist. It's not an easy job. But
Right.
the thing is, yeah, it's very difficult.
Right.
And the reason I tell you, the reason why, because, being an Indian woman, our upbringing is different from the Western world. We have been born in a family. Yeah, we have born in a family where our parents used to, give 100%. So we have also, so we are midway between. We cannot be just leaving everything on, the way the Western
So you feel
children
over
are.
2 decades of your experience, the situation has improved over the years?
Now has improved and has drastically changed. The
Right.
way we used to be very keen to our children upbringing, to be a part of every ifs and buts in their life. Now the things have changed.
Right.
And that is the reason, our thinking have changed, our looking at the perspectives of so many things have changed. And that is the reason why when I'm not being the medical director of my hospital, I look into a different way. So
Right.
most of the responsibilities that I give, I'm more happier giving to a woman. For example, I give you, if I have ward boys and ward girls in my, indoor, for my indoor patients, what I feel that these ward girls are more sympathetic, more, soft spoken, handling the situation.
Right. So we'll come to
responsible.
those issues also. Yes. So let me come to another senior oncologist now, Dr. Anita Ramesh from Chennai. Do you share these same feelings? Do you think the oncology climate in India is already gender equal or gender neutral, or do we need to do a lot more to make it gender neutral? Dr. Anita? Is she there? Has she logged in? If not,
we can proceed
there are
further.
some technical
Dr.
issues.
Bhavna,
So she is not
Dr.
joined.
Bhavna from Mumbai, Dr. Bhavna Parekh.
Yes, hello.
Yes.
I thank both the Dr. Jyotis for this wonderful opportunity given to me. So I had joined my oncology training in 1993. And at that particular moment of time, whatever observation I made is that we had wonderful women oncologists in our department and in our hospital. But somewhere I felt that actually they were not being used as their full potential. And I felt that they were not in the leadership roles. They were not the mentors, though they were excellent. So somewhere there could be multiple factors. That could be family pressures, or it is just the natural sacrificing, nature of a woman, which also could have been responsible for all this. Or they wanted to avoid confrontation, and whatever it may be, I'm not very sure. But that is what I observed at my institute when I was there as a trainee. But I feel that that leads to some kind of a little insecurity subconsciously in the mind of trainees. So when these women oncologists ultimately from training come out in practice, they also may not have that much confidence compared to male trainees who have passed out. So that was one observation which I made. Otherwise, I'm born and brought up in Mumbai, which is one of the most cosmopolitan cities of our country. And I always made my own decisions. So I never had such a problem.
Right.
During my practice, when I started my practice in 1998, and I'm an individual practitioner into private practice now for almost 25 years. And I work at different hospitals. Particularly at one of the hospitals when I had joined, I had a lot of resistance from my male colleagues because I was the only female over there and they didn't want me to be there actually. But I just continued working, and ultimately I managed to establish the chemotherapy daycare there, medical oncology department over there. So ultimately you have to be, your perseverance counts and your quality of work.
So do you feel that the climate has changed over the years?
Yes. Certainly. I think in last few years, definitely things are better. I completely agree with that. So we did had problems, but today it is definitely better.
Let me come to you, Dr. Sevanti, now. Since you have been trained in India and abroad, do you think there are some India-specific cultural factors which make, women don multiple hats, and therefore sometimes or often at the cost of their career advancement? Dr. Sevanti?
Hi, Dr. Jyoti.
Yeah.
Good
Yes,
evening.
I can hear. Yeah,
And,
good evening.
Also, Dr. Jyoti Vajpayee. So thank you again for having us all here. I see many women leaders here. Yes, there are differences between the Western system and Indian. We are all privy to that. I just have one thing to say. All of us all here are a statement that yes, there are gender biases, and time to accept that we are superior. Yay. So that's what I have to say. I mean, I think
did you feel any difference, or you feel that in West also there is, a difference faced by women oncologists, or is it, in India that we feel it more, or because I feel it's a global issue. So, and we need
Absolutely.
to work
I do agree with you that this is a global issue. The biases do persist across, and it's a relative term. So the biases are different in our country and different abroad. It
Right.
definitely exists in all kinds of professions, and also in the medical field, and definitely in oncology. But our job as women leaders is to negate that. And I think we've all done a fair job to do that, and we've run with the baton, and that's why we are all here.
Right.
So I said,
And-
I feel inherently that we are the superior clan.
Mhm.
Yeah.
Right. Okay, great. And let me come to the next pertinent question. Is there a difference between public and private sector? So I'll pose this question to Dr. Smita Kayal from JIPMER Pondicherry and Dr. Meenu Walia from Delhi. So one from public and one from private sector. Do you feel there's a difference in the way you would have experienced? So, Dr. Smita, what
Yes.
has been your experience and your personal experience and your observation regarding your colleagues also, your colleague women oncologists?
Thank you, Dr. Jyoti, for this and for the participation and invitation. I've been trained in the public sector throughout during my MBBS, MD, DM, and I'm working in the public sector, government hospitals throughout. So my experiences and observation in the private institutions is very limited.
Yeah.
In the public sector, yes, there are different challenges we face. Some are real, some are perceived. Varies from person to person. Some are actually gender neutral, which are common to everybody working in our setup. And there are different challenges in the, getting several things done in the government setup, which is there for all. And some are actually gender related, which are fortunately for me have not come across any major issues. Some challenges are there at the workplace, at home, with colleagues, with students, with staff, with patients as well, patients and their family in counseling and discussions. So no real major experiences of which are gender specific challenges. In the private setup, I have limited experience to comment on that. Other panelists and Dr. Smriti, she can comment.
So are you working in a women-led team or women majority team, or how is the structure there in your?
So in our department, we are 3 faculty. 2 of my colleagues are male. I'm in my department, I'm the only female oncologist, but in radiation oncology, in other departments, we have female colleagues also. If we say in the entire institute, the ratio may be 6:4 or 7:3.
Right. Okay. So let me ask you, Dr. Meenu Walia, since you work in a corporate sector, so what has been your experience over the years?
So before I begin, Dr. Jyoti, I would like to thank both Dr. Jyotis for the invite and the opportunity. And before this private thing, I what I'll say a very pertinent thing which you asked is the bias there or was it there earlier, and whether over the years has it changed? So I think the very, very important point is the bias has always been there. From day one, from my residency, I think I don't know how many of us will share the same views. When I was a resident, quote, unquote, I can, the people who would tell what a stream that you have chosen, because this is a stream with so much of mortality. People are going to die, and then there will be agitated attendants, and you're going to get phone calls. How will you handle that? And quote unquote, these were the words. You will have agitated phone calls. You will have people who will be out there to have, with lot of hard feelings, and it is not easy to handle. And this is definitely not a line for a lady to be there. So these are the things which we have grown up with.
And even today, as I feel, I don't know how others take it, but I feel over the years, the feeling is no different. It just keeps on coming back in a different form. The form may be different, but it is there, it is underlying each and every corner, each and every aspect. Something like what I'll say, uh, if mine is basically a male dominated, our specialty is a male dominated field, and you are generally one or two ladies in the field. So the questions, the gender bias come at all the aspects. The gender bias in a private setup even comes from your what do you say, the owners, from the people you are employed with, because whenever they are hiring a lady, a big question mark comes whether she'll be able to devote so much time, whether she will be, there must be personal strings attached, there might be families at home. She may not be able to devote the same amount of time, energies to a corporate setup what is generally required. So those question marks are there right from your employers, right from the superior most bosses, from that. And even the positions, like all the positions, I say, you would have realized, as we grow up, your uh, there are certain positions which are very, very important, and there also a big question mark comes whether a lady will be able to do justice to that position. And the same in a different manner also is when you find that when you grow senior, there is not so much of acceptance from your male juniors or male counterparts taking you as a senior, which I
So do
strongly
you
feel
feel,
might have been.
sorry to interrupt. So do you feel, or are you implying that the experiences would be broadly similar in public and private sector, or they are more, questions bound or likely to be asked if you are in a private sector?
I think it will be very much different between the public and the private sector.
Right.
So in a private sector, there are different kind of pressures, there are different kind of expectations.
Right.
And definitely, I strongly feel in a private setup, the bias also becomes more just because of these factors.
Mhm. Right. So I would request the audience to please keep posting the questions, and our panelists would be very happy to take them towards the end of the discussion. Let me come to you, Dr. Roshni Bhagwat. You are from Jabalpur. What kind of setup are you working at? Is it a public, private? Are you part of a team? Do you lead it, or you have a team with you? How does it work for you? And what has been your experience, Dr. Roshni? Do we have Dr. Roshni logged in?
Yeah, I've seen her logged in.
Okay.
Dr. Roshni, are you mute on something?
Yeah,
Or
can
maybe
you hear me?
yeah,
Yes, yes. Yeah.
Yeah, good evening. Sorry. I'm in a private hospital, but it's a private hospital with a difference for me because my interest is more public-centric approach. So what I do is a lot of free service for patients. So it's like working in a medical college. Now, talking about what Meenu was saying, what I feel is what her issues were, maybe it's a regional problem also, because having worked in Maharashtra and Tata Hospital and then moved to Jabalpur, maybe the perception of male doctors or male personnel around you is more related to the region, North India versus West, or North India versus East, the way you treat females in general, the way boys are brought up versus girls.
So what is the difference, if you could, put it in words in terms of regional differences, since you have been in Mumbai and now you are in Jabalpur, and I'm sure you would have traveled within India and shared or experienced as oncologists. So what has been your experience? Does it vary? And how does it vary from place to place?
So as a medical oncologist, being a female also, I have not perceived any threat or any gender bias. But what I have seen is that male doctors perceive women doctors as different, especially in medical college. Male doctors will look at a female doctor as if anyway she's going to take maternity leave, anyway she's going to take all her casual leave, anyway when her children go through 10th and 12th exams, she's going to sit at home and that we are going to do all the work. So it's basically a patriarchal society. Same thing is for females at home. The responsibility at home is much, much more. We are taking care of our children and our in-laws or our parents at home. So our responsibilities are to balance the work life and the family life. And though we are totally committed and maybe much more, especially in COVID pandemic, we were doing both, including maybe teleconsult, WhatsApp or telephonic. So we have given our best, but still the perception is the oncologist has to be first a mother or a wife and then her professional commitments. But as per patients, they don't see you as different male or female. Once they accept you, they do accept you irrespective of your gender. Of course, there is a high dropout rate also after MBBS. Lot of female doctors for the same reason are probably not able to pursue the MD and DM due to the same reason, unless you get a very committed partner. So your partner, your life partner, if he's understanding, or your family, in-laws, if they are understanding, I think there's nothing stopping you. In Tata Hospital, we had some wonderful women, Dr. Dinshaw, Dr. Bojes, Dr. Kurkure and Dr. Reena Nair, who are there, and Dr. Smruti, whom I'm always admired. So we really didn't feel the gender bias. It was a gender neutral situation there.
Right.
Thank you.
Thank you, Dr. Roshni. You have brought out very pertinent points and very clearly and in a very crisp manner. And I'm sure these are not just, limited to women oncologists, but women physicians in particular, and very crisp points. And let me hear from you, Dr. Manisha. Have you experienced, how have you been able to manage family commitments? Or have you seen that women colleagues of yours found it difficult coming back from maternity leave, or coming back to work? What was your experience?
As I told you earlier, to maintain a work-life balance is just like walking on a tightrope, I said. So there have been situations, when kids are small and we have to look after your in-laws, as Roshni said, that it's a real tough situation. But the thing is, you have to give you 100%. And if you give you 100%, your colleagues, your administration, your whole society, everyone sees, even a God sees you. And this was the reason why I climbed from a very lower, being just a simple resident doctor till the medical director. I'm what I am.
You given your 100% to reach where
I gave my 100%. I told you it is a very very difficult situation for everybody. But then you have to set your priorities. Being a doctor, I just cannot give way that I'll have to give time for majority of the time at home because my children are small. I have to make a balance, and that maintaining a balance is a very, very tough job. But if you give your 100%, and it's not like if I'm pregnant, I'm taking a leave. So I take it for granted that the leave has been granted. I'm just going to leave my work away and let's see what is going to happen. So even if I'm on leave and I'm concerned regarding the part of the duty that has been allocated to me, I'm really doing justice to that. I'm honest to my work. I think everyone looks at it. So when I was being, given the post of the director, as Dr. Meenu said, that there were a lot of finger pointing that if you have a situation, emergency situations, there are some, definitely you'll have, will a lady be able to go to attend the night calls or to handle the situation being the director? Can she represent physically? So there's always leg pulling. But then but there was suggestions that you can have a medical superintendent, you have other doctors holding the post, giving the mail that they will handle the situation when a lady cannot come at night 2 p.m. to handle the situation. So right. What I feel is you need to give your 100%. You need to be honest, true to your job. Definitely, that pays and that matters. And then the society also who are leg pulling you, they will also bend down and they will accept your, the hard work that you have given, and probably you will get the reward for what you have done. So this is what I feel.
Great. So thank you for that. And let me hear from you, Dr. Deepti Rani. I see you are a professor of oncology at Cuttack. So did you experience any difficulty in terms of attending international conferences or going in for fellowships? Or do you have any colleagues, women colleagues, who would have experienced such a, difference or bias? Dr. Deepti Rani? Yeah.
Yeah, thank you, Dr. Jyoti. Dr. Jyoti Bajpai and Dr. Jyoti Vadhwa to invite me to this session. It's a very interesting session. Whatever I want to tell you, I work in a public sector. the public hospital, the regional cancer center. I am having 3 colleagues. 3 of them are male, and I am the 4th one who is heading the department. I agree with Dr. Rosni, but in sometimes we can feel gender bias. This is a feeling, we can feel it. You cannot see it. If you're feeling a little bit harassed in your department, then from when you are a junior colleague, I'm now professor and heading the department. Now I'm not feeling that situation. But when you are growing from a budding oncologist, in that situation, somebody should guide you, somebody should mentor you. And in that situation, if you are going a step down, at that time you cannot prosper in your career.
Right.
In public domain, I have felt it, and still there gender bias is existing. It is a global problem. Whatever you told, it's a global problem, not a local problem. It's a global problem, and all of you should fight against this gender bias somehow. If somebody should speak or somebody does not speak, but there is gender bias existing till yet. But it has changed over time. Whatever you told, it has changed over time. Our perception has been different. When it was very acute and we are feeling it acutely, now we are not feeling it very much in a awkward fashion, but still then I feel as a lady director, as a lady professor, when you are women oncologist heading your department, sometimes you will see your institutional director, institutional head, they are not very much confident with you as other male members. This is the feeling in India, in women oncologists in India. I very much openly admit it, and I do not know others, they will admit or not, but for me, this is the feeling. And I congratulate Manisha, because of course, you should maintain a balance between your home duty and your hospital duty. Definitely the balance should exist, but always you cannot do 100%, but you try to do it 100% in your home, because you are administrator at your home, you are a teacher at your home, you are taking care of your in-laws, taking care of your children, your husband. You cannot give up this job. You have, as a biology, your biology suggests this, you have to do it. And on the other hand, that's why you have to congratulate women oncologists, because she has to make a balance at home and at your workplace.
Yes, fully agree.
We are seeing this gender bias. I cannot deny it. Dr. Jyoti Vadhwa, it is over.
So thank you, Dr. Deepti. You have put in very clearly and honestly that we have to first be aware that it's there, it's there, you have to accept it, and only then you can move on to tackle it and, take your team along with you. And once another point that you brought out beautifully is that you experienced the challenges when you were growing up as a woman oncologist. And now that you are heading the department, I'm sure with that experience, you are ensuring that you do take care of your junior women colleagues. And I'm sure you are more sympathetic towards their, requirements and their goals. And I'm sure you are supporting them fully well.
Definitely.
So another point beautifully brought out is that we need to, as women oncologists, women leaders, we need to support each other and support our women colleagues even more to bring out the best in them. So very well said there, and that's exactly the role that would be played by various societies, the ISMPO, the initiative that Jyoti has taken, the global support that we are getting, because it's a global issue, and I'm very happy to see the participation and the efforts at all levels. So let's move on. And let me ask you, Dr. Bhavna Parekh, how have you been able to achieve work-life balance? As we have all said, the panelists are saying that we as women oncologists don multiple hats. And I'm sure at some point we do end up compromising one or the other component of our life. But then it moves on, we try to compensate with time. So what has been your experience as to attaining the work-family balance? What has been the experience over the years?
Yes, I mean, already I think all our colleagues have agreed upon that it is a difficult task to balance everything. But I think we have to balance it. There is no question about that. And to some extent, we must have even restriction of working hours. I have seen this is applicable even to male colleagues. It's not that only for us, but there should be some restriction of working hours. Sometimes I have seen doctors just working continuously, which is not good for their health. And we also must try and pursue some hobby. There should be some me time. Otherwise, what happens that you will get a burnout phenomenon. So though we all have responsibility, say, of our children, our parents, and our patients, but we also have responsibility to ourselves, which we should not forget. And I think if I am happy, then only I will be able to make others happy. I very strongly believe in that. And that is why I always kept some of my hobbies on. And that is how probably that has helped me to balance my life and enjoy both my work as well as my home front.
Great. So, Dr. Sevanti, do you feel that we as women, we bring in some distinctive, qualities to our team, to our professional team? So is being a woman oncologist in somehow or some way better than being a male oncologist? Do you have that feeling, or what's your viewpoint? A tricky question though. Dr. Sevanti? Are you there?
We can move on maybe if there is.
Dr. Smita, let me hear from you. Do you think women oncologists bring in some added value to the team, to the oncology team? And if yes, then what are those points? Yes.
Yes, definitely. We bring more value to the entire team in organizing the work better. So most of the colleagues which I have worked with, mainly the women colleagues, they are more organized in their work. They are more dedicated to their work. They put more effort into their work. In my residency times, I used to complete my work, and the notes and everything were appreciated. Got appreciation for the dedication to work. Similarly, my seniors, Dr. Jyoti, Dr. Jaya Ghosh, she's in Tata. The people at my institute, they still remember her dedication to work. So yes, women and female as residents, as physicians in the leadership, they are more dedicated and they bring different organization skill.
Right. Dr. Meenu, what are the other value additions that women oncologists bring to the team, to the oncology team? Dr. Meenu Walia?
Yeah.
Add something?
Hello.
Yes.
Yeah, Dr. Jyoti, can you hear me?
Yes, yes.
So you were asking about value addition, what women oncology bring to the team.
Yes. So what is it that we as women, bring to the oncology team? What is it that, we add on?
Yeah, I feel as women, there is a lot that is added to this specialty rather than any other specialty. Something like what I feel is oncology is one branch which requires a lot of the other aspect also, the emotional aspect also, a very sensitive kind of issue, and lot of what as a woman can talk and discuss and feel for the other patients. I'm not too sure, but that might again be another gender bias. Men possibly will not be able to express the grief and the sympathy and the comfort. Possibly in a different manner. So I guess there is a lot that women also bring to this field, and especially if it's something like female cancers. So ladies suffering from breast cancer, gynecological cancers, I somehow, maybe again, this is a bias, it's probably another kind of a gender bias. I always feel that women oncologists in these lines can do much more, can connect much more with the patient than probably anybody else.
Right. So anybody else would like to add on here?
Can I say something?
Yeah, please. Yes.
Yeah. See, when a breast cancer patient comes to us, the way the male doctor perceives it, like the surgical oncologist, if he's a male, he will look at the patient in a very different way, especially where I am. They would suggest an MRM. Whereas being a female, I would push for a BCS. Because, naturally understanding that she's a female and I'm a female and we have to do the best. Secondly, we discuss infertility issues, fertility issues, and lot of other things, the feeling of feeling good, etc. Now, if I have a head and neck cancer patient coming to me, I see the patient along with his wife. And if I cannot do anything for him, we would discuss that palliation, the symptomatic to her and ask her what she's going to do. Try to give her ideas at how she's going to lead her life, how she's going to bring up her children, and get the extra people coming in like attendants, and give them the responsibility that they have to take care not only of the patient, but the wife and the child or the children who are going to need an education. So we are going to be more empathetic. We are going to listen also. We are going to give more time, because we are not running after patients. We are not counting numbers. So I think we are more humanistic. And of course, we are more organized. I always used to admire Kurkure Madam. She was organization at its best. And we tend to be also try to be perfect, which we should not be, but we try to. Thank you.
Right. So let me ask you, Dr. Smriti, you are the senior most amongst all. And I would like to hear from you as to, what value additions do women oncologists bring? Because I am personally also of the opinion that we bring more holistic view to the management of a disease like cancer. We bring in more empathy, more sensitivity, smoother communication. And obviously, when it's women-related cancers, I think we do a better job. But Dr. Smriti, what has been your experience, and what's your viewpoint on this?
Well, I've been hearing the comments of all my other colleagues, and before I come to the point that you are asking me, I'd just like to say, because I think me and Dr. Asha Kapadia, and of course my colleagues like Dr. Poona Kurkure, we were some of the first medical oncologists, and I would say that, although it was a little uphill task and you need to do a little more to prove your worth, but once, you proved your worth, then at least my experience has been that, we have received equal treatment from our male colleagues. So if you prove your worth, though it may take longer time and more perseverance on your part, but once you're accepted, then I think you're treated quite equally, at least in the private setup. Now, coming to what other things that women can add to oncology, I think all the points have already been brought out. So I think I'll be more reiterating what others have said. And that is that definitely we have a more holistic view. We are more sympathetic. We hear all the problems that the patients have. Maybe sometimes the male colleagues may not have so much time for that empathy and holistic view, but I think we do have a little more patience in hearing and trying to sort out other issues also apart from oncology. So I think that is a lot helpful to the patients, and also for their treatment.
Right. So thank you, Dr. Smriti, for sharing your viewpoint. So let me ask you, since we have discussed the challenges, the issues at hand, what are your suggestions for improvement, to achieve a more balanced workforce for women oncologists? So let me take your views, one suggestion each from all of you. And let me start with Dr. Bhavna Parekh. What's your suggestion to improve the situation?
So the first and foremost is, I think everybody has agreed that we must not give up and we must continue our work. And once your work is valued, rest of the things, they fall in place. Having said that, I still personally feel that there are certain issues like sexual harassment and all, which are still underreported and under discussed. Now, if we really want, then I personally feel that there could be a committee in every hospital to tackle gender related problems. These problems can maybe occurring even to male colleagues. I'm not trying to say that everything is related to women only. So there should be some committee where if this kind of a problem is occurring, then at least one can report to, because I have seen these problems generally don't occur between the colleagues. They may occur between a junior person and a senior person. And then the junior person doesn't know where to go and report it, which I have myself, I have been witness to one of the incidences, but there was nobody to report to. So these kind of committees can tackle problems even faced by males. I'm not trying to say that only females are at receiving end.
Right.
Sometimes
so
males are also at
specific
receiving end.
committee for a specific purpose. Yeah.
Yes,
Agreed.
yes.
So that's one good suggestion. Dr. Deepti Rani, what's your suggestion to improve the situation further?
Actually, we work in a peripheral institutions, like we are away from like Mumbai and Delhi, and whatever we feel here, always we are not able to correlate with other colleagues. I think there should be some groups. There should be some groups, which groups will talk among themselves, like WhatsApp group, where you can exchange your opinions, your ideas, and by which we can just keep in touch with our colleagues. And any problem will happen, just we can exchange our opinion, by which more strengthening of ambitions, more strengthening, mental strengthening we'll have, and by which we will not feel that we are neglected. And sometimes there are some senior fellows, some senior members, somebody are there who will guide us in time of stress, in time of need. And this is my feeling. There should be some groups in future. Groups can correlate with other groups and other international groups also, by which you can go ahead. We can move our thinking, our opinion ahead also.
Yeah, so you're suggesting better connectivity and some sort of networking within our country and internationally to support each other in times of need.
Yes,
that's what you suggested. Great suggestion there. Dr. Manisha, what's your one suggestion to improve this situation? Dr. Roshni, your suggestion to improve this situation?
See, I have 2-3 suggestions. One is that we need to have flexible education programs. The virtual webinars have been very comforting to me, since initially I always felt that we couldn't go out to conferences because of our commitments here. We need childcare facilities in the hospital to be able to manage your children when they are growing up. And I always feel institutional practice is the best practice for women, or a group practice that is more comfortable.
Right.
Am I audible now?
Yes, yes.
Dr. Jyoti, yeah. My suggestion was representation of more and more women on a national platform, so that we are more and more visible to show our worth and our potential. Like what Jyoti has done today to form this GLOW and have brought us together. So such type of platform should be given to more ladies, so that we show our worth and the potential, so that everyone agrees and recognizes our capacity.
Yeah, very good suggestion there again. And Dr. Meenu, your suggestion, one suggestion to improve the situation?
So what I say is, Jyoti, charity begins at home. So the first question that we all need to ask ourselves is, now that when we have reached a position, a leadership position, are we gender biased or not? Are we maintaining the non-bias against whenever I am hiring a young female oncologist in my department, a young female resident in my department, or do I also worry about the maternity leaves and the leaves, or whether she'll have to run back home? So this is something, the change which is required, and this should first come from the women. From the women themselves, from we as a team, it should come. And hats off to Dr. Jyoti and others and everybody who thought of this idea, that there is now a forum where we can discuss and we can get connected. And wonderfully, the idea of networking and connectivity given in this forum, where we can talk about it. And let's begin with at least supporting the female members, the female colleagues, and that should be the first step. And then, yes, committee also is another good idea.
Right. So thank you, all the panelists, for great suggestions there. Dr. Kurkure, madam, I think madam is there. So if I could ask you, madam, Dr. Kurkure, in your opinion, how can we make the situation better for women oncologists in India, since you are a very, very senior oncologist yourself? What would you like to suggest to improve the situation further for all of us and the future women oncologists?
First and foremost, congratulate Jyoti and you for conducting this session. And I am interacting with the audience for the first time. So let me tell you my story by saying that I have never faced a gender bias. And I feel that women empowerment in India is so big. And we have always valued a woman and its Nari Shakti, that I don't think that there is, if you determine to do certain things, you can do it and you should do it. It is the determination of woman which decides the outcome. And we are stereotyped in the society that we are supposed to look after our family first. And if you become very highly professional and aggressive professional, you are jeopardizing your family. That is not true. And woman is meant to feel guilty. I think the first thing which we should all give up is this guilt feeling that being a woman professional, we are jeopardizing our family. Never. We never jeopardize our family. We should be aware of our own empowerment and our own Nari Shakti. And if we decide to do something, I think we can do it very well because we are more organized. As a woman, we are more organized, and if we put, but this stereotype on from the society which we accept very easily that we are female and that is why we should run low. This gives the man an opportunity to override. So I think the most important thing for my female colleagues, I would say that give up that feeling of that you have to jeopardize your family, feeling of guilt. That is the most important thing, I feel. And that one should give up and feel that you are capable. If you are interested, you are capable of doing things and do with dedication, and you can reach where you can reach. There is no problem at all. I started my career in 1982 and I have as back as that, and I have never faced any difficulty. You have to have a supportive family, no question on that. But I think if you show that you want to pursue your things and if your family is good, they always support. But we only tend to give up very easily with the guilt feeling. I think that I would reiterate again and again that women should not underestimate themselves, not feel guilty.
Yeah, thank you, madam, for that very precious viewpoint and statement. And thank you for guiding many subsequent generations of both men and women oncologists in India. Thank you very much. So coming to the concluding part of our very important panel discussion, wherein we did discuss the regional challenges posed by women, experienced by women oncologists in our country. We are all aware that cancer is a major public health problem, not only globally, but also in India. We have a huge cancer burden to deal with, and there is already a shortage of human resource. Just to reiterate that we are just over 2,000 oncologists for 10 million patients in India, and the distribution of oncologists is already so uneven in our country. So the human resource in form of women oncologists is really, really precious. And we need to support each other. We need to help each other grow. We need to look after the budding women oncologists. And very happy I am today to see that a lot is being done to improve the awareness, to bring out more activities. And our Indian Society of Medical and Pediatric Oncology also taking a lead in supporting the concerns of women oncologists. So thank you. Dr. Govind Babu is also part of the panel. Any final comments from you, Dr. Govind Babu, sir?
Yeah, Jyoti, I think you've done a great job of getting all the things that you were aware of, but you didn't have a place to voice it. I think all the points have come out nicely. I totally agree with you. I think as women oncologists, you bring in that extra thing that we men can't do. And I'm saying this at the risk of being beaten up by my male colleagues. So that is there. So I definitely agree.
Yeah.
I definitely agree with you.
Thank you for being supportive. And similarly, we have many other male oncologists all over the country, spread all over the country, who have been very supportive in all our endeavors. So thank you.
Dr. Jyoti Vadva, can I just make one quick sentence?
Yeah, very quick. Yes.
Sure. No, I just want to say that, even the smallest of the injustice, women should not tolerate. Once they tolerate the smallest one, the bigger one will follow. So that is the only thing I would like to tell my friends.
Right. So let me conclude by thanking the leader, Jyoti Vajpayee. Great job, great initiative. Let's continue the efforts, and I'm sure with the support of great men around us, we are bound to succeed, and the work environment and the workforce would obviously strengthen further over the coming years. So thank you for giving me this opportunity to moderate this very important panel discussion. Thank you.
Thank you. Thank you.
So thank you, Jyoti, and my namesake, of course. And as you all are, saying with a sweet smile that both Jyotis. So yes, we are privileged to share this. Also, we are privileged to share many of our thoughts, commitments towards this larger cause. So I'm grateful to Jyoti for excellent moderation. I'm grateful to all the panelists for excellent interaction and. Also the floor participation, which was really great. I'm receiving several messages on personal chat as well, which I'm keep on collecting, and at the end we are we will be formulating meeting proceedings which will perhaps give overview, and there are mixed views from both the sides. We need to reach out to some conclusions and progression. Thank you, the esteemed chairpersons, for very excellent and augmentation and taking the session forward. Now we'll hand over the mic to Priyanshi again for next session.
First, I will request, before moving on, I would request to all the faculty members to keep their mobile phones on silent mode and adhere the time allotted. You can ring a buzzer on the close to the session end. Thank you so much for your cooperation. We now moving on to the another interesting segment of this summit, which is our first keynote address, for which I would like to invite Dr. Hemant Malhotra, Professor and Head of Department of Medical Oncology, Shri Ram Cancer Center, Mahatma Gandhi Medical College, Jaipur. Dr. Kumar Prabhas, Professor and Head Medical Oncology, Tata Memorial Hospital, Mumbai. Over to you, sir. Thank you.
Thank you very much, Priyanshi. Can you hear me and see me?
Yes, sir, we can hear you.
Great. So it's a real pleasure and privilege to be a part of this, if I may say so, unique webinar. Even though I'm slightly intimidated by the magnitude of the women power we see, my personal belief is that there is absolutely no difference, discrimination, or should be no difference, discrimination between men and women, not only in oncology, but in every sphere of activity. So a real pleasure for me to be part of this webinar, and I thank the organizers, particularly Dr. Kumar Prabhas and myself, that we have this unique opportunity to be a part of this unique webinar. And it's our privilege now to invite you all to the first keynote lecture. And this is very aptly titled How to Say No Effectively. And the speaker for this first keynote lecture is Dr. Soo Pin Chu. Dr. Soo is Director of Curie Oncology and visiting consultant at the National Cancer Center, Singapore. And she's also a very active member and part of the ESMO Women for Oncology community. So I'd like to hand over to Dr. Chu now for the first keynote lecture. Over to you, Dr. Chu.
Thank you very much, Dr. Hemant. Can you all hear me before I continue?
Yes, we can hear you well.
Okay, great. Hi, thanks so much, Jyoti, for inviting me to speak today. I'm very empowered by what I just heard in the last 15 minutes or so. Dr. Herman and Dr. Kumar, you are very brave to come to this forum with so many powerful women in your presence. You know, I think it sends a very positive message to all the women and all the female oncologists, and I feel empowered myself, you know, being in this whole group here, and I want to congratulate you guys for gathering this group and creating this forum. Okay, how to say no effectively in the context of gender equality and beyond, I would say, not just in terms of gender equality, but of course we are here focusing on the female oncologists today. And I'm supposed to talk about this in 15 minutes. Of course, I have a disclaimer first. I'm not sure I'm the best candidate to do this since I failed to say no to this talk. Of course, my husband will disagree with this all the time, you know. I know how I say no to him all the time. But I mean, what I mean is we oncologists are well versed in giving talks and lectures on survival curves and adverse events, but I'm not exactly the TED Talk type who will give people life skill advice or tell people how they can transform their lives if they say no to the boss. I'm obviously not a psychologist who can analyze why people find it so hard to say no either. So apologies up front if this talk falls short of expectations, but I hope that it would at least stimulate us thinking about why we should say no, when we should say no, there's a time for everything, and how we should say no, whether we want to say no very nicely or not so nicely. So in this, as you all are, I know for sure, you're all the multitasking females here. Female oncologists, we are generally high achievers who made it through medical school, night calls, years of specialist training, patient duties, admin duties, research duties, and then outside of work, some of us may have years of diaper changing, baby drooling, chauffeuring of babies, parental duties, household chores, even daughter duties as well as wife duties. The list goes on. And we are often seen as multitaskers, and we are told that women are better multitaskers. But are we really? So there is some research, and there's one in PLOS One, which was published in 2019, that looked at whether women are better at multitasking than men. So in this study, basically they tested gender differences between men and women in terms of sequential multitasking, that means task switching, as well as concurrent multitasking, which is dual tasking. And then they controlled for possible gender differences in working memory, processing speed, spatial abilities, and fluid intelligence. And you know what they found? Women are not better multitaskers than men. Okay, we are just doing more than at one time. And he found that multitasking resulted in substantial performance costs across all experimental conditions without a single significant gender difference in any of the 10 measures that they did. Okay, but you know, we are okay. But you know, we are we are female oncologists. We tend to be the yes, we can do it kind of women. We don't want to offend the boss. We don't want to offend the colleagues. We want to be collegial and cooperative and be a team player. And if we are not a team player, we don't want to be seen as incapable, right? We want to be seen as a doer and a reliable team player. So, but you know, sometimes there are reasons to say no, right? There's only 24 hours in a day. We are super women, but we also need to be very clear on our priorities in our lives. And sometimes when we say no, we are really saying yes to a greater opportunity or something, activity that's more aligned to our expertise, goals, or values. And furthermore, we need to set boundaries, right? We can only develop deeper relationships and deeper connections, whether it's in our personal lives or in our working lives, if we have time for people. And of course, there's an issue of balance. Success is measured not only in the workplace, but also in life. Okay, we need to be able to draw certain boundaries such that our work doesn't eat into our personal lives and family lives and cause problems in our family lives. And when we say no, we also are telling people, look, we have the confidence to say no. We are not easily manipulated. We are not just here just to please, you know, and people respect you for making your decisions this way. And sometimes saying no also empowers us to focus on what we're good at or what is more important and can help us to be more successful. So I'll tell you a story of one of my most competent junior residents. Her name's Jen. She was very intelligent, very efficient, superb with patients, was a real doer. And you know, we all have these kind of junior residents or medical officers or even registrars in our departments, where everybody knows that they are really good, and everybody sends them all the different tasks. So you know, every senior consultant who needed a project done would look for Jen. You need someone to sit in infection control committee, you look for Jen. You need someone in the residency welfare committee, again Jen. And maybe some of you were this person some years ago or still is that person now, right? You cannot say no. Jen couldn't say no to her seniors. She didn't want to seem like she wasn't coping when she was given all these responsibilities. So by the end of her 3rd year of training, she had 8 research projects with 6 different consultants. She was staying back till late for meetings on top of her grueling clinical work, and she was juggling all this while trying to sit for oncology exams. She was obviously tired, but of course she was not the complaining type and just plowed on. And guess what? When the exams came, despite her being the most trusted senior resident in terms of looking after patients and being very reliable, she didn't pass her exams because she just didn't have time to study like the rest of the candidates. And some of these candidates were definitely lesser doctors in terms of capability than her. And then she had to repeat an entire year of training. So we do have to say no sometimes because we can't split ourselves up completely. And the reality is that we often overstretch ourselves before realizing it, and I'm guilty of it myself. And sometimes it's hard because you want to say yes all the time, but you know, you have to know your limits. Okay. And sometimes we have to say no to stand up for ourselves as well in inappropriate situations. You know, we might be asked by a senior to do something that's unethical or that will put us in a compromising situation where our dignity or safety is in question, and we have to stand up to that. And we also have to stand up to bullies as well. Okay, and since today we're talking about gender equality in oncology and all that, I'll tell you a story about when I was studying in England as a medical student. So I had this classmate who really wanted to do surgery, and her main interest was colorectal surgery. It's a real story. Okay. She was an Irish girl, very bright, quite a pretty girl. And let's call her Sheena. Okay. So when it came to our rotation in colorectal surgery, she was truly excited because this was, wow, the thing that she always wanted to do would be a colorectal surgeon. But you know, in England, at least almost 30 years ago when I was in medical school, at the hospital I was at least, colorectal surgery was an old boys club. You know, all these guys with super egos talking rugby all the time, hanging out at the pub every Friday evening, and you know, talk very real boys, you know, bravado and stuff like that, you know. And in the department of colorectal surgery, there wasn't a single female surgeon actually. Then Sheena would turn up every teaching session and OT session full of knowledge because she'll read up because this was her pet, something she was interested in, very enthusiastic. And she made it known that she was interested in becoming a colorectal surgeon. And there was this senior consultant colorectal surgeon that said this to her. I was there, the two of us, two little scaredy cat medical students. And he said to her, why would a sexy lass like you want to be spending your time digging around people's butts. You should use your pretty face and stick to something like family medicine or dermatology instead. It's like, okay. I mean, obviously, when I was standing there, I was like, oh my goodness, are you kidding me? But, you know, we're just a bunch of medical students. And this guy was like a senior consultant, deputy head of department. And we were like, whoa, it's too stunned to respond. Obviously, now in my maturity, I would have snapped back at this guy, you know, for being sexist and all, and being inappropriate as well, and rather lewd, if you ask me. Okay, but this is what we need to say no to. Okay, but we don't say no and miss opportunities. You know, and which is what this cartoon is saying. But that's one situation where we have to stand up for ourselves. Okay, and sometimes saying no is also you know, cause it's the right thing to do, right? Like if you have, I had another story. Sorry, it's all about stories because, you know, I don't know how to do these talks otherwise. You know, I have a surgeon, had a very a surgeon friend who was very gifted, and everybody would call him for help in OT when things went south or when surgery was difficult. So there was this other surgeon who was really famous. He was known for research. He was always in the media. He was made for a name for himself around the region. But we all knew he was really lousy with his hands. You know, just couldn't operate. But every time he would still, you know, do a surgery and then call the gifted surgeon in to help him and save the day. And it happened repeatedly. So the gifted guy was getting really fed up, but he never said no because he always felt that he should save the patient first and never mind about you know, what this other lousy surgeon was doing. And the not so good surgeon would take credit and success, you know, for after the surgery was successful, and you know, things like that. You know, do we allow this to happen in our own lives if we are in a similar situation? So we need to be able to say no when things are not right, when it doesn't help the greater good. We need to say no because we need to think about some of the things we need to think about when to say no is whether it will help us focus, whether align with our beliefs and our goals and values. I know something makes us uncomfortable or is downright inappropriate, I think we should say no. We also need to be able to say no when it's going to burn us out or make us more tired or it's bad for our mental health. And then there are questions when we say no, would saying yes make us regret saying yes? And maybe we should have said no. So it's, you know, and something you really dislike and you're going to end up doing a 6:30 effort in it, perhaps we should say no. I mean, there's no, this is not a full list of when to say no, but it's just things to think about. And we're all Wonder Women, but we all need a break as well. And taking a break doesn't make you less of a superwoman. Okay. And how do we say no nicely? Well, sometimes we can just say, instead of saying no outright, we can just delay things and say, switch it to later. Let me think about it first. I'll get back to you, for example. We can always acknowledge the opportunity. Thank you very much for this opportunity, but you know, I'm a bit busy at the moment with other things, perhaps another time. Okay. And sometimes we need to rehearse our no as well, especially to someone who's very senior and intimidating. And sometimes we have to run it, may have to run it by someone more senior to give us the support when we are saying no to someone who might be more upset if we say no. And sometimes we don't have to give an explanation. We end up giving all sorts of excuses, and sometimes it sounds even weaker than it is. And perhaps sometimes the way to say no is to offer an alternative or suggest, hey, you know, so-and-so is better for this job. Maybe you should offer it to so-and-so. But sometimes an outright no is just required. Whatever it is, I think we have choice. And it's up to us to make that choice. You have brains in your head, you have feet in your shoes. You can steer yourself any direction you choose, says Dr. Swiss. And that's it. Thank you.
So I think Dr. Kumar is here and he will give the closing remarks for this particular session.
Thank you, Dr. Jyoti, for inviting me, and thank you, Dr. Shu, for a nice lecture, and totally agree. I think so. Not only one can say no, no means no, and especially in Indian context, it's very important. We have, considering the number of women we have, the participation of women in professional activities is hardly 10% odd, which doesn't reflect good on as a country. And I think so we need to create all kind of environment to see that they feel welcome and they do participate in professional activities. So absolutely nice lecture, and I enjoyed it. And many of the anecdotes I agree, absolutely not right and disgusting, in fact doesn't reflect good on us. Thank you. I enjoyed hearing.
Thank you.
And I enjoy being part of this meeting, and thank you, Dr. Jyoti, for inviting me.
So thank you very much. And I would also like to put on record that Dr. Kumar is one of those who would not be annoyed if you will say a justifiable no. So on this positive note, we will move from here. And thank you, Supin Chu, for this excellent lecture. And
Thank you,
I would
Jyoti.
always say, and I posted as well, that to say a no and not really annoying the other party is really an art and science, a mixture of both. We need to master that, and you have really provided some excellent points. So perhaps we need to have a crash course from you.
Oh.
And thank you, chairpersons Dr. Malhotra and Dr. Kumar for excellent moderation. So now we'll move on to the next session. Over to you, Priyanshi.
It is a time for our next keynote address, and for that, I would like to invite the great personalities Dr. K. Govind Babu, past president of SFO, very senior medical oncologist in HCG Hospital, Bangalore, Dr. Madan Pia, Director, National Hospital and Cancer Research Center, Nepal. Over to you, sir. Thank you.
Thank you very much. And Jyoti, as I mentioned earlier, being here since the conference started, and as Dr. Malhotra also said, I feel really intimidated that all of you are so powerful, and hats off to you. So coming on to the next keynote address, and this is titled How to Survive in the Political World. And for this, we have a great speaker, Dr. Narjit Flores. She's a program thoracic oncologist from the GLOWS Center for Thoracic Oncology at Dana-Farber Cancer Institute, and she's a member of the faculty at Harvard Medical School, USA. I'm sure you'll have a great talk from her. Just to mention, I did a fellowship several years ago at Dana-Farber, and it's one of the best centers that you can train for your fellowship. Over to Dr. Flores, please.
Hello everyone, my name is Dr. Narjis Flores, formerly Duma, and the Associate Director of Cancer Care Equity at Dana-Farber, as well as a medical oncologist. Today, I had the pleasure to discussing with you how to manage in a political war. As we talk, we're gonna say how to survive or manage in a political war. These are my disclosures. Whether we talk about political work, for many of us, we joined the medical workforce after several stereotypes, rules, and regulations were placed. Many of those rule, regulation, expectations were created when medicine was mostly composed of men. So a lot of those standards are based on their performance, based on their needs, and not the needs of the 50% of the rest of the population, which are women. Based on the new data, oncology represent females in oncology are around 35 to 36% of the oncology workforce. This change, based in different locations, we can see a higher number of women oncologists in Latin America and lower numbers in Asia. But the point is that we joined after several standards were established and several regulations. It's often that women encounter gaslighting or encounter situations in which they are trying to be measured with a ruler that cannot measure us. An example of that appears is RVUs. RVUs is a way of measuring productivity for a female or male physician in the United States. How many new patients do you see? How many stable patients do you see? Women tend to spend more time with patients, and for that, the RVU tends to be lower. We are more likely to listen to our patients. But when it comes to the time of being measured by productivity, women and men in oncology are measured to the same rules or the same standards, whereas the same number of RVU that women are expected to complete than men, when in fact those were created at a different time. Also, a lot of expectations don't take into account the societal responsibilities of women associated with child care or with elderly care. So we are expected to attend to the same meetings, to the same work, when we still have higher social responsibilities and higher responsibilities at home. So all of these creates an environment that's highly political, because women are less likely to go up the ladder, because we have to be twice as good to be considered equal, and we have twice as much as responsibilities. One of the big issues that affect these establishments is gender bias. So gender bias comes with the perception that one gender may be better at a role than another, and it's all largely based in stereotyping. So one example is that women are better at caring and men are better as leaders, when in fact there is no data that supports that women cannot be leaders and that women cannot take on big responsibilities in the administrative work of hospitals. But it's believed that women are better at taking care of patients and less leading organizations. The majority of those issues are based on gender bias. This is me as a second-year resident. I joined the residency in the United States as a Latina. Latinas represent less than 5% of physicians in the United States. And this picture was taken around 10 years ago. So at that time, the representation on Latinas in the medical force was even lower. So what this shows is that, I was I was only a few, and in many parts, and many times, I still remain to be the only Latina at the table. So I was often labeled as too passionate. You're so fascinating. You're out of the box. You're too ambitious. You are so Latina. And the most striking, you're very smart as a Latina. So one of these is, first, it shows the stereotyping is not only related to gender bias, but also related to race and ethnicity. I was in an environment that was not used to me. It was not used to have a Latina that had an ambition, goals, and a strategy. And that led to depression and feeling excluded. That word made me feel excluded. As the consequences of this, I wrote the article that was recently published in the Journal of Clinical Oncology, or JCO. It's Our Oncology, and it's labeled My White Coat Doesn't Fit. This summarizes my journey during training of how to navigate a world in which I didn't fit in. But I didn't fit in because the world was established in rules and stereotypes that didn't take into account people like me. "63 studies have showed that women that assert their ideas, make different direct requests, and advocate for themselves are like less. So if you have characteristics that are shown to be male predominant, you are most likely to face gender bias and repercussions for communicating directly and for advocating for yourself. So 63 studies. But the question that remains is 2021, almost 2022, when will we stop punishing women for violating outdated gender stereotypes? Why do we continue to punish women for violating these gender stereotypes from the 60s? So one of the things I recommend when trying to navigate a political world that has really helped me in my career is to advocate through data. When you advocate through emotions or anecdotal experiences, those tend to last only a few minutes and people tend to forget. But when you bring data about inequalities, when you bring data about gender bias, when you bring data about discrimination, it's very hard that the people sitting at top, the people related with promotion will ignore you. So I recommend, as you navigate a political war, to advocate through data. Many of you know this piece of my work. So I was in ASCO 2018, and I saw that women were less likely to be introduced by their professional title. I put a Twitter poll, and around 32 people answered, but the sense is that women were less likely to be introduced as their professional title, meaning doctor last name or doctor full name. So we conducted a large analysis of introductions at ASCO 2017 and 2018. And what we discovered is that female speakers were less likely than male speakers to receive a formal form or address, 62% versus 81%. And female speakers were more likely to be introduced by first name only. So these data that was later published at the Journal of Clinical Oncology shows that the anecdotal experience of many women was true. So we advocated through data. We had a publication in a high level journal that eventually changed how we see introductions at ASCO. Subsequently, thanks to the publication, we collaborated with ASCO with creating the language of respect. The language of respect also includes how we communicate with patients, but it has a very important instructions to chairs, to moderators, that everyone deserves to be addressed by the professional title, and they should not be stripped of their credentials. So through advocacy through data, we were able to generate change. Something that I also found is I was very isolated to be a woman in medicine, a Latina in medicine in the United States. So we created the online community Latinas in Medicine. And what we found is that we have been able to generate change, amplify Latinas, and share their stories, but most important, understand the power of number. When you are navigating a political war and when you're trying to generate change, the power of number matters. Survey studies, large studies, and importantly, having several women that back up your change or your ideas is important. When you navigate a political war, do not forget the power of numbers. I founded the Flores Lab. These are many members of the Flores Lab, and I hope to get more recognition for the work that we do. Often when you do research in cancer health disparities, health outcomes, you don't get the same recognition that some other type of research. So founding an institution that provided a safe space for many of these women and men was key, because that allowed to get a place in which everybody has backup and feels like they can be their true selves. The Flores Lab has become a movement, and we have created a community that focuses on improving the outcomes of all patients with cancer. We really focus on social justice and gender bias in discrimination in medicine. So another recommendation is make yourself a brand. Understand you are a brand, and when you become a brand, then people may take you more seriously when you collaborate with other people. So another tip to how to navigate a political work is to make sure you create a research group and that you become a brand and they're recognized. When you're trying to develop a program, make sure that you include people from all different levels, including junior members. This allows that they have a safe space and also that your work is recognized. There are several lessons I learned that I would like to share with all of you. First, I always say this: their ego is not your problem. When you are navigating in a place in which rules and regulations were created not to include you, then you shouldn't worry about their egos. We often, as women, are very worried about how certain activities may exclude people. So what you need to be inclusive, that your drive, your ambition is affecting their ego, is thus being your problem. Also, I always channel my inner abuelita. So my abuelita or grandma, she is very straightforward and honest, and people know that. So I strongly recommend that you continue to add direct requests, because that allows for lack of communication and for you to get what you need. When you're negotiating, the worst thing that can happen is getting a no. But I think that negotiation is very important. Negotiation should be addressed every year with your superior. It should be addressed as often with hospital administration. And this includes no negotiation only about salary, but negotiation about space, about support, staff, time that you are away. So negotiation needs to happen, and needs to happen without fear, because the worst thing they can do is to say a no. And sometimes you are afraid of being labeled as too ambitious. And honestly, ambition is a beautiful thing. Are you being called an alpha woman? Well, yes, you are. You're an alpha woman. You overcame many challenges to become a leader in your specialty. We overcame residency, fellowship, and everything else that is around. So when they tell you you're an alpha woman, embrace it. Yes, you are. So these are tips on how to help each other, which is very important. Remember, the power of number. We're stronger when we work together. So you can bring others to the table easily, like Chenoa. What can we do next? Narjus, do you have an opinion about this? Together or as by yourself, you can call manos. Manos are panels that only compose of men. Also, it's important that you advocate for more women and other members of represented groups to be keynote speakers or panelists. I often, when I decline an invitation, I suggest at least 3 other women. And that is easy and quick to do. Suggest other women when you decline an invitation. And if you're invited to be in a panel when you're the only woman, suggest 1 more woman. Also, learn about shortcuts. What are some shortcuts in your institution that men have taken advantage of that you can also take advantage of? They're always a shortcut sometimes. So things to remember, your voice can reach many that are struggling. Many, like when I was a resident, I was struggling in silence. So your voice and advocacy has a lot of power. Remaining quiet or silent is a form of validation. So when you're trying to navigate a word that was not designed or created for you, remaining quiet suggests that that model is working, when in fact it's not. So do not remain quiet. And remember that you as an individual have the power to create change and create gender equity in your institution. It has been my pleasure to be with you. I'm sorry I couldn't be with you in person, but feel free to reach out anytime through social media, to email. And remember that you belong in medicine, you belong in oncology, and you are generating change every day.
Thank you, Dr. Flores, for that wonderful talk. And you really put up some very important issues which you have specifically faced during your tenure in the United States. I think oncologists in India do not face so much problems, at least that I'm not aware of. At least in the place where I worked, I made sure that the women who worked with me did have the same privileges or even better privileges than the men oncologists in that place. Thank you very much. I am not sure if there are any questions. Jyoti, over to you.
Yeah, thank you very much. Indeed, it was a great talk, very inspiring, and many important pointers. So I would request Dr. Madan Pia to conclude the session, and then we will move on to the next. The questions which are pertaining to this particular question will be handled during the panel. So Narjas, I would request you to please be with us till end. Dr. Madan Pia, are you there?
I think so. He's not there.
Okay, so then we have already heard Dr. Babu regarding the closing. So we'll move on to the next. Pianshi, over to you.
We now move on to the next keynote address. Let's welcome Dr. Ahmed Ejaz Masood and Dr. S.D. Banawali to chair the session and begin the proceedings. Dr. Masood is an immediate past president, SFO, professor, senior oncologist, Nistar Medical University, Tata Memorial Hospital, Mumbai, India. He's known for gender equity and concept of metronomic therapy. Over to you, sir. Dr. Ahmed Ejaz Masood.
I have just heard him, rather he was messaging as well. I hope should be any connectivity issue. Is Dr. Banavli with us? We can request.
Dr. Banavali is Academic Dean and very senior medical oncologist, Tata Memorial Hospital, Mumbai. So, Dr. Banavali. He has also not joined.
You can show the slide for introduction, Priyanshi.
Priyanshi, Dr. Banavali is there.
Okay.
Sir, can you please unmute yourself?
Yes. Hello.
Hello, please, sir, go ahead.
Yeah, sorry, actually, I did not have the audio connection, but thank you for inviting me to be the chair of this this next talk, and this is an important talk. Again, I think I should congratulate Dr. Jyoti for bringing out this very important topic, and even at the academics, we see there are very few women oncologists that are there in our group here, but very importantly in the academic section, actually in academia, there are much more women representing medical oncology than what I see in as a students when they come for the DM program. So thank you, Dr. Jyoti. So the next talk is the importance of mentorship and sponsorship for women oncologists, and this is going to be given by Dr. Pilar Garrido, who is basically the Women for Oncology Committee Chair, Associate Professor Medical Oncology at the University de Alcalá in Madrid, Spain. Dr. Pilar.
Hello, everybody. Thank you for giving me the opportunity to participate in this session. I would like to share my slide, if possible. Okay. I cannot find. Sorry, I cannot attend. I cannot.
Did you send us a backup, Pilar? Otherwise, we can display from our end as well. Mayur, do you have a copy?
Yeah, I can send you. I don't know what.
Yeah.
I have this problem because
Dr.
usually.
Dr. Pilar, can you try once more to share the screen, please?
Can I try again? I don't know. Can you see my slides right now?
No, not yet.
No.
Not yet.
Okay. Can I send you by email, Jyoti, and then you can
please,
try?
Please send.
Okay, I will do it in a second.
Introduction. So can you show the slide for Solen's introduction, and can you call upon the next chair, please, Priyanshi?
Yes, ma'am. Okay. Now, moving on to an important part of the event, the keynote oration, I would like to invite Dr. Jyoti Bajpai for the proceedings.
So do we have
Okay,
Dr.
Dr. Banawali, can you introduce the next chairpersons?
Do we have Dr.
Yes.
Jayakumaran and Dr. Pankaj Chaturvedi already joined?
Doctor.
I can see Jayakumaran, so he joined. Dr. Jayakumaran is here, so.
Priyanshi, can you introduce Dr. Jayakumaran and then Dr. Jayakumaran can
Okay.
take it
Dr.
forward?
Jay Kukumaran is a SFO President, Consultant Clinical Oncologist, National Cancer Institute, Sri Lanka. And Dr. Pankaj Chaturvedi is Head and Neck Surgical Oncologist, Tata Memorial Center. Over to you, Dr. Jayakumaran, sir.
Yes, good evening, everyone. Now we are moving to the next program, that is the importance of collaborations between international societies and regional societies, and the place of women in that. So I am actually glad to invite Dr. Simon Peters, the current ESMO President and Chair, Medical Oncology Department, University Hospital, Switzerland. And also, I would like to say that so far we are trying to talk about more about the women's right and equality. I'm very glad to say that Sri Lanka is the very first country where the first woman premier, late Mrs. Bandaranaike, came out from Sri Lanka, even though the West, a lot of women equality is existing, but in states so where we are not seeing many women in a premier state and so on. So another thing I have to say is a male is in the female, a man is in the woman, he is in she. So with that small note, I would like to invite the Dr. Simon Peters for this oration. Over to you, Dr. Simon Peters.
Thanks a lot. So I will need you to stop sharing so I can try to share my slides. I guess you should stop sharing. Yeah. Let's see if I can do. Yeah, it looks okay. Can you see my slides?
Yes.
I'm lucky today it works. So thanks a lot for the wonderful introduction. It's very important, and you just brought by your words the dimension not only on the importance of national versus international collaboration, but what is quite important is to stress the importance of collaborating across professions, across societies, across probably subgroups in the societies, in order to make sure that what sometimes we are able to phrase out in our very educated environment can also reflect and act and change the way the whole community might be affected and negatively affected by a gender disparity. So I think it's quite important to go a little beyond through diverse countries, diverse professions, to try to understand how we can work together in, at the end, addressing the same type of consideration. So you'll see my talk goes first national, but goes a little beyond across some principles I had the opportunity to explore in the last 5 to 10 years in this field. So to start, my disclosure of interest. And starting about this nice slide about the global challenge, I think, as I said before, that it's not about my country or even Europe, but to address gender inequality and the challenge it imposes, we need to collaborate at a global level. We need to bring together people with diverse skills, not only politicians or economists, diverse experiences and resources to coordinate efforts and identify some stereotypes we might ignore about. That's why we tried to launch in ESMO across our professional environment, but maybe also in the future and in general, trying to go beyond medical oncology. I'd like to remember this dimension of very broad environment for diversity through this Sustainable Development Goals. Remember the SDGs, which are, created by the WHO and really stand everywhere when you go to Geneva. You have to remember that gender equality belongs to Sustainable Development Goals, meaning that point number 5, without gender equality, societies will not be able to grow the way they could. In our ESMO Vision 2025, we have put all our activities, education, politics with sustainability, as well as our community around the concept of care. So it's about a community which is optimizing care, meaning gender equality, but also optimizing care for diverse patients. So I think we should never forget also the dimension of patients. When you look at ESMO, I hope now ESMO is reflecting more or less the oncology professional community or society with a lot of members, as you can see, but half our members are today women, and they represent today 42 specialties. Importantly, too, half of them are less than 40 years old. While I'm already old, I think the less than 40 years old oncologists, or professionals, will be able to change more than we could, the whole perception of gender. It's about diversity, inclusion, and global collaboration, which was at least at the heart of everything I have tried to do during my presidency, and I'm sure ESMO will continue. We have first, as everything, to recognize the diversity and to value the diversity as our leading principle. It means including all its forms. In ESMO, it's about specialty, age, geographics, gender, and of course also cultures. And by serving this ever-growing base of doctors everywhere, we will be able to really deliver optimal cancer care wherever we are, wherever we work, to all the patients suffering from cancer. And I think that is the basis of this global collaboration among all stakeholders and key opinion leaders in oncology. Pilar will speak a bit more about some specific initiatives we've been doing in Women for Oncology, but Women for Oncology Committee in ESMO that I created some years ago has the aim of raising awareness and promoting equal access to career development opportunities for women oncologists while providing a platform for networking. Here is the collaboration with other women oncologists and national groups. And this is a list, I'm sure Pilar will stay a little more on this list, of the current core member and extended member of the W4O Women for Oncology Committee. Just goes through the name, you have in a glimpse the idea of diversity, men, women, and geography, and I think it's extremely important. I would like you, when I speak about oncology and beyond, just to spend 2 minutes on 2 very important reports. The first one was the Council of Europe, which is the main body of political movements in Europe trying to move specific societal topics. And they published in 2018 this gender equality strategy, which is supposed to last for 5 years. And we just look at this conclusion that these politicians who are pretty conservative decided to write down. Even if progress is visible and the legal status of women in Europe has undoubtedly improved during recent decades, effective equality between women and men is far from being a reality. Gender gaps and structural barriers persist in many areas which limit women and men to their traditional roles and constrain women's opportunities to benefit from their fundamental rights. So it's quite important to see that even a parliament, right-sided, moving with conservative, have to conclude like that. The second thing, which is pretty more conservative, is the World Economic Forum, the WEF, remember, who decided to publish the Global Gender Gap Report in 2018. They were looking at 4 fundamental categories: economic participation and opportunity, educational attainment, health and survival, and the last one, political empowerment. And you can see by continent on the right, but in general, the overall index for women versus men. And as you can see, the political empowerment subindex was extremely low, as many of the other topics. And they calculated in this gender gap report that based on today's status and the trend observed over the past 12 years, it will now take 202 years, for example, to close the economic gap, and probably something like 1,000 years to close the political gap. So quite important to keep it in mind. Fixing the gender imbalance in healthcare is, of course, our topic. Keep in mind these US numbers. In US, 3% of healthcare CEOs are women, 6% department chair, 9% division chief. But if you think about it, 80% of workers in health and social sector are women. Female health workers are paid approximately a third less than male. And once you try to account for occupation and working hours, the gender gap remains more than 10%, which is simply not acceptable. This was also led by many communities, and we wrote an article about it. Gender transformative policies are needed to address these inequities and eliminate gender-based discrimination in earnings, about this pay gap. Of course, remove barrier to access to full-time employment, and also support access to professional development to a salary which is high enough. Why is it still difficult? For many reasons, but there's something I really always like to illustrate. This is an article from Harvard Business, which is, again, quite conservative, just trying to show how women have to manage the gender norms of leadership. A wealth of research has shown that women leaders, much more than the male, have to face a kind of incompatible type of features. They have to face the need to be warm and nice, what society traditionally expects from women, as well as competent and tough. So the problem is that these qualities are often seen as opposites. So, for example, you can see these 4 paradoxes in this Harvard Business Report. You have to be demanding, yet carrying. You need to be authoritative, yet participative, advocating for ourselves, yet serving others, and maintaining distance, yet being approachable. So we have this dual role where we cannot become a leader if we are asked to be a bit like a mother in the same time. And this is also how people speak about it. And in this same Harvard Review journal, there was this interesting comparison how male and female entrepreneurs are described by venture capitalists. So just look at this wonderful table. A male is young and promising, arrogant but very impressive, aggressive but a good entrepreneur. I can send you the slide, it's a wonderful one. But a woman is young but inexperienced, enthusiastic but weak, experienced but worried. So all of this kind of stereotyping through language which underpin the image of a man as being a true entrepreneur while undermining the image of a woman as the same. So very importantly, this, I would say, stereotypes that are deeply, deeply written in our societies. So what can the woman for oncology do? So first of all, as I said before, we need to report, to show what was happening. And I can tell you, to start in ESMO, people didn't believe that we were suffering from any gap in ESMO. And first of all, we had to show the numbers of the inequalities and the gender disparities. But we had to convince people it was existing, right? Sorry. So second thing is to observe how it evolves over time and the details of this gender gap. Then to inspire the change and to practically support the change. So what did we do? We could act as an international observatory first. So we have, and Pilar will show you, we have monitoring studies, we have surveys, and we try to communicate this data, make everybody committed and aware through forums or roundtables, interactive talks, sometimes on Facebook. Because the first move always starts with communication, information, and data, like everything. So second thing is to try to act as a career booster in educating and training the oncologists, and particularly the female oncologists. We have now mentoring sessions. We have forums where we try to have people interacting and finding resources. And again, through the roundtables and these activities, we try to connect people to the resources they would need. And last but not least, the law, how the children care, how the maternity leave, how your part-time job might be treated is a political national issue. ESMO cannot lead to changes at the political level in each country. So the last point is, of course, to connect all our data and our knowledge to national societies, because only the national societies are able on the ground to really change the reglementation, all the rules and the laws, which will impact the daily life of men and women. So as you can see, we have been connecting with many countries, and it's a growing kind of and broader other a bunch of societies. Now the French are interesting, the Swiss too. So we try to grow it because we have to keep in mind that politics happens where you live, in your region, your country particularly. So the conclusion of this talk has been also promoted a lot. And you know, now it's an observatory by the Lancet. We have this constant discussion in ESMO with this Lancet Observatory for Gender Diversity. The conclusion is there is considerable and persistent gender gap in science and medicine, career advancement, remuneration, leadership opportunities, sexual harassment, care and domestic burdens and assessments have to be stressed. This has been, unfortunately, terribly amplified by the COVID-19 pandemic. So gender bias has to be called unjustified and unacceptable. Diversity policies can backfire and fail if you don't have a top-level active engagement. And we need to convince the bosses that they need to be committed, otherwise it will never work. We need a strategy and you need a budget to do so. And last but not least, what you need to fix is the system. It's not the woman. And with this, I thank you for your kind attention.
Thank you, Dr. Solange Peters. It's a really interesting and very informative talk. Really speaking, we have to have the collaboration with international societies. As far as we know, I'm very happy to announce that at the SARC level, we have formed the Women for Oncology in the SARC regions, and Dr. Jyoti is the chair of that, and she will definitely do some networking with ESMO and other international organizations related to oncology. And also, this collaboration will definitely help us to form more and more information sharing and some mentoring and other upliftment or improving the knowledge and skills in oncology, because there's a gap in technology as well as there's a gap in the treatments relating to our economic issues and all. So we have to study on all the aspects, and even through the collaborations through Women for Oncology, we could able to offer a better treatment, in equal treatment to global oncology patients throughout. Thank you again, Dr. Solange Peters, for your wonderful and informative talk. Thanks.
Now I would thank you very much, Solange. Indeed, it was an excellent presentation as always, and I always admire, from your side, acknowledging that yes, the gender, difference exists. I think when we are moving towards the larger aim of gender equality, first we need to really acknowledge and accept that this kind of, biases, this kind of difference exists, and if it is exists in ESMO, it is existing in the world. So that would be, my first and foremost acknowledgement and appreciation to your talk, and there are many, many others. Now I would request Dr. Banavli to felicitate Dr. Peters for this wonderful keynote oration, and we will be, presenting here the virtual plaque and the certificate, and because soon we are going to meet in person after the COVID has come back to near normal state in ESMO Congress, where we will be having opportunity to, hand over this plaque and certificate to Dr. Solange Peters in person. So Dr. Banavli, over to you, please.
So thank you. So how do we do that? Yeah.
Sir, actually, I mean, this is innovative. You take your way and please confirm.
So I think this is a beautiful plug. So maybe as soon as possible, if you can hand it over physically to Dr. Peter, it will be great. So congratulations and thank you for the beautiful talk and bringing out the subject so well. Thank you very much.
Thanks so much. It really goes directly to my heart, I must say. It's very dear to me, first of all, to be connected with you all and to see this international point of view and commitment. This is rare, right? There are few topics, politically speaking, where we collaborate so strongly because of diversity of the topics also, but also because of how important and priority we find it is. So I think it's the work also of Jyoti, because Jyoti has been in Women for Oncology since the very beginning, right? And she was a young oncologist, an LGP, so it's paving the way all together of something which will probably, and I hope we have to defend it, right? be one of the priority of ESMO, ASCO, AACR, all the societies in the future. So we should never forget about it. I always speak, when I speak about gender disparity, that's something you have to bring back again and again and again. When you make a program for a meeting, you have to raise your hand and say, be careful, women are missing. So for the next 25 years, we will be insisting again and again and again to defend this topic. But thanks to all of you, we can do it, because being alone is too difficult. So it's thanks to everyone. The plaque is to all, right? Thanks a lot.
Absolutely, and I completely echo the sentiments, and I'm really grateful what ESMO as a leader and as an international society is taking, and is a flag bearer actually. And Solange, truly with your visionary work way back, where this problem is acknowledged, and then the Women for Oncology committee, and we are taking baby steps, infantile steps, and children's steps to take the mission forward, together with many other societies like ESCO, SIDSI, and now in Asia. And as Dr. Jayakumaran just spoken, that we have established this in SARC Federation of Oncology as well. We have established the Indian Society of Medical and Pediatric Oncology. Also, there is a Women for Oncology wing, and now this momentum is really spreading and taking a voice to Asia, Africa, Middle East, everywhere. And we are seeing here now we have 20 countries representation here today to towards this larger goal of establishing gender neutral environment in oncology at some point of time. So thank you very much, and we will move from here to the next segment. So Solange, I would request, I know that you have a flight, but we definitely want your inputs for the next panel as well. So after Pilar's talk, there will be a panel. So whatever time you will be able to be there in that panel, it will be really, really useful.
I will be there. Don't worry, I will be on the phone. So strange picture, but I will be there.
Absolutely. Thank you very much. Thank you very much.
Thank
so
you.
Now, so over to you, Priyanshi, again. Thank you very much, chairpersons, Dr. Banavli, Dr. Jayakumaran, for this great moderation and proceedings.
Thank you, everyone. Now we move on to the next keynote address. Now let's welcome Dr. Ahmed Ejaz Masood. He's immediate past president of SFO, professor, senior oncologist, Nistar Medical University Hospital, Multan in Pakistan. And Dr. Banavali is academic dean and very senior medical oncologist, Tata Memorial Hospital, Mumbai. We know he is known for gender equity and concept of metronomic therapy. Thank you. Over to you, sir.
So Dr. Ahmed is there.
Just have seen him, and I think he messaged me also that he's trying to speak, but probably his audio is not well connected. So I think, sir, you need to again do the needful.
Okay, thank you. So once again, I'll.
Can you hear me now?
Yeah, we can hear you. We can hear you.
Please go ahead, please.
Okay, so I thank once again Dr. Jyoti for inviting me as chairperson, and I would like to invite just a minute for the talk on importance of mentorship and sponsorship for women oncologists. And the speaker is Dr. Pilar Garrido, Women for Oncology Committee Chair, Associate Professor, Medical Oncology, University of de Alcalá, Madrid, Spain. So I welcome Dr. Pilar Garrido for her talk.
Thank you again. I hope this time I will figure out. Okay, perfect. So can I move the slide, or I have to say every time? Go ahead. Okay. Anyway, we will try. It's a pleasure to be here and to share this meeting. Thank you, Jyoti, for the invitation. I am a medical oncologist, head of medical oncology department at the Ramón y Cajal Hospital in Madrid, and currently, as you mentioned, Women for Oncology Committee Chair. The talk is the importance of mentor and sponsor. I try to...
You will have to ask for change of slides.
Yeah, I think I can. In fact, I can.
Now we are viewing your screen here. You can do it now.
Okay, perfect. Let me put. Okay.
I think you can make it.
1 second.
Slideshow,
yeah,
please.
I am trying. Yeah, I am trying to do it. Okay, 1 second. Yeah, okay,
Yeah,
already.
thank you.
No? Okay, so the talk is the importance of mentors and a sponsor. This is my disclosure of interest slide. And I would like to start by sharing some open questions. The first seems easy. What does it mean to be a mentor? A mentor is an experienced and trusted advisor who gives help to a less experienced individual. It's in sample. However, when I was preparing this talk, I realized that not all languages have a word for mentoring or mentor or mentee. It means that this concept, it doesn't seem to be as popular as one might think. And when thinking internationally, it's important to take into account local and cultural aspects. For instance, the lack of a word for the concept of mentor. Another open question is, do women need different mentoring programs? It seems that according to some studies in other areas, not in our field, for instance, a study performed in 2010, more women were assigned mentors. However, men still receive 15% more promotion. And apparently the reason behind is that many of these men had a sponsor. So in my opinion, mentoring is key also in our field, but insufficient for advancement. And the third question is, do the oncology women need a specific mentoring program different from other professional women? In my opinion, no, but we can discuss later on the debate. So how are women working in oncology doing? As Solange said, the Women for Oncology Committee have been performing a lot of hard work in different areas. Every year collect information about authorship and monitoring data, and some data were published last year in a paper in ESMO Open. The title of the paper was Female Leadership in Oncology Has Progress Stalled, and the reason is because of this kind of numbers. For instance, every year we ask for the numbers of women as invited speakers in different national and international congresses. And as you can see, the percentage was 29% in 2014 and 39% in 2020. Taking into consideration that most of the congresses in 2020 were virtual due to the pandemic. So the increment was enough? I don't think so, but we can talk about that later on too. And in particular, if we split the data from different areas in the world, we can see that even the percentage of women as invited speakers in national and international congresses is different, the percentage depending on the region. About 30% in Asian countries or South American countries, 40% in when speaking about European countries. We also collect information about the women president of oncology societies from 1916. And as you can see here, the percentage changed from 10% to 27% in 2020. Currently, for instance, from the ESMO perspective, 50% of our members are women. Having 27% of women as president of oncology is enough. The evolution is good enough. We can debate about that later on. We also collect every year the information about women as first or senior author in top oncology journal. And as you can see, this data were also included in the paper I have already mentioned. And it seems that data didn't change significantly across year, at least when analyzing 2017, 2018, and 2019. The numbers are particularly worried when thinking about that last author is a key factor for CV and for the development of career. So less than 30% in 2019, I think there is a clear room for improvement also in this area. And as Solange said, we are really concerned about the potential different impact of the pandemic on women and men. And in fact, we launched a survey which results were also published last year in ESMO Open about this topic. And one of the conclusions is that women had reduced research time in comparison to men in the field of oncology that may have long-lasting career consequences. This is why the ESMO commitment was clear not only by Solange speak, but also when thinking about the next president, Dr. Andrés Cervantes, who was the one who wrote the editorial in which he highlighted that there is still much to be done, and this new data should serve as a start, reminding that progress is not irreversible. And I think, for me at least, that this is one of the key learning from the pandemic, that that has been acquired cannot be lost. No, and this is quite relevant as well, the commitment of ESMO in this area. When we try to analyze the reason or the main barriers that prevent reaching gender parity in the oncology field, we launched also a survey that was in 2016, that was published in 2018, in which lack of mentor and lack of self-confidence were one of the most relevant reasons that prevent gender parity. So now I would like to move to a second part of the keynote, trying to identify what is a mentor, a sponsor, and coach, because these three terms are usually or are often used as synonyms, but the truth is they mean and imply different things. Of course, all of them act with the goal of helping people progress in their career, but a coach talks to you, a mentor talks with you, and a sponsor talks about you. I think that in the oncology field, the more relevant terms or figure are mentor and sponsor. And the differences are that a mentor gives you perspective while a sponsor gives you opportunities. And a mentor helps skill up while a sponsor helps move up. A coach is usually someone who asks powerful questions to people so they can come up with the answer themselves. Coaches help improve performance related to a particular issue, and their service is usually paid. Relationships with coaches are usually defined by a specific goal that has been set up by the coachee. A coach holds you to account and pushes you out of your comfort zone, stretches you, but in a way that makes you feel comfortable with discomfort. After a conversation with a coach, a person should be able to clearly identify the obstacle they need to overcome in order to get to the next level. However, a mentor is usually a professional who has more experience than their mentees and is a few steps ahead in their career. They help you to navigate your waters through the prisms of their knowledge, experience, and expertise. A mentor advises. A good mentor offers guidance, stories, and advice based on their life experience to help mentees navigate their own journey. Usually, to be as relevant as possible and facilitate the transfer of knowledge, mentors come from a similar industry, geography, or career background. But the truth is that there are different types of mentoring. The traditional one adult to one young person. Group mentoring, that means one adult to up for young people. Team mentoring, several adults working with a small group of young people. E-mentoring, mentoring via email or the internet. Or peer mentoring, that means relationship between people who are at the same career stage of age, in which one person has more experience than the other in a particular domain. Peer mentoring may be one-to-one or experience in a group. And in fact, there are different examples about how peer mentoring can be useful at any stage of a professional career. And in this slide, we can see some examples. For instance, at early stages, can help learning the ropes, defining professional roles, working on work-life balance, helping to gain visibility, preparing for advance. Also, mid-career steps can be useful for networking, maintaining visibility, leading a team, mentoring others, reassessment or redirection of career. And finally, even in late career steps, can be useful to maintain knowledge, to assume consultant role, recognizing other expertise, and also even for preparing for retirement. And finally, a sponsor is usually a senior stakeholder with solid connection, a great network, and social equity. A sponsor adds, they believe in your value because this brings value to them. A sponsor is willing to use their reputation and credibility. They endorse proteges directly, using their influence, power, and networking to help give them exposure to better career opportunities. When compared to mentors, sponsors are more invested in their proteges and they take bigger personal risks to champion them. In other words, only those people with access to position of power and leadership can serve as a sponsor. So there are a lot of information on the internet about the differences among mentoring, coaching, and sponsorship. And as I mentioned, I think in oncology, sponsor and mentors both are needed. Sponsor act while mentor advice. And I like the example, and I like this cartoon because it's a good example about the different approaches. For instance, the mentoring approach to a specific person is, have you tried applying to speak at conference and meeting already? While the sponsorship approach is, I recommend you for this speaking gig. Can you do it? So it's completely different and both are needed. And particularly for women, as I mentioned at the beginning, according to a study in 2010, women are over-mentored and under-sponsored relative to their male peer. And men are 45% more likely to have a sponsor than women across industry sector. These are not a survey based on the oncology field, but I think reflect our reality too. And apparently, if you have a sponsor, there is a way you are going to be better paid, improve advancement, and many other advantages. So both are needed. So what is ESMO doing in this field? ESMO launched a virtual mentorship program in 2020. This is a 12-month program designed by the ESMO Young Oncologists Committee with the aim of matching ESMO Young Oncologists with a senior ESMO leader to promote personalized learning, support career development, and guide individual mentoring needs. And here you can see the people that act as mentor. As you can see, an impressive panel of leadership from the ESMO world, including our president, Solange Peter. These are the mentors for the program 2020. So within our committee, the Women for Oncology Committee, we decided also to establish a mentorship program. But finally, we decided to explore a pilot experience between the young and our committee. And the decision was to offer 5 virtual mentorship opportunities specifically for women working in oncology. So we merge our mentorship strategies. I also mentioned at the beginning that this is key to identify local needs because culture is also relevant in the gender equity field. Based on that, we started an experience in which we invited different colleagues from different countries to make a survey or to develop a survey with the idea of publishing a series of papers in ESMO Open named gender needs on different countries. In fact, the result of gender climate in Indian oncology was published by our Indian colleague and led by Jyoti. The Spanish experience was also published, led by Elena Elet, and also the Italian experience. And as also Solange said, we wrote an editorial about that named Gender Gap, Surveying the World for Tomorrow. So I invite you to collaborate with us in this initiative because it's important to include the local needs in the gender equity field. Finally, I think that it's important to know what are the results of the initiative you put in place. So based on the survey launched in 2016 and published in 2017, ESMO launched a series of initiatives trying to address the obstacle because that survey showed a severe underrepresentation of female oncologists in leadership role. Last year, our committee decided to launch a follow-up survey in which we wanted to investigate the progress achieved, but also we wanted to add some questions to know the potential impact of ethnicity, sexual orientation, and religion on the career development. So this is my last slide, and it's an invitation to join us in the ESMO Women for Oncology Committee Forum at the ESMO Congresses on Sunday, the 11th of September, in which we will discuss all together what were the achievements from the ESMO perspective and the need for now and for the future. So we will be very happy if we count on you for be part of this forum. Thank you.
So thank you very much, Dr. Garrido, for bringing out the differences between the coaches, the mentors, the sponsors. And I think the other thing that the women oncologists require, especially the young ones, are the role models. And thank you, Dr. Garrido, Dr. Peters, for being excellent role models, and including Dr. Jyoti here from India, because that's what the young women oncologists need. So thank you for the excellent talk, and I hope that the number increase. I just as a passing remark, I also do pediatric oncology, and I can say that in pediatric oncology now women outnumber men. So I think slowly you all want to take over the medical oncology also, or at least bring 50-50 balance there. So hopefully in the near future that will happen. So thank you very much, and over to you, Jyoti.
So thank you very much. Thank you very much, Pilar, for this excellent talk and bringing out those pertinent points for mentorship, sponsorship, why we need, and what all we are doing as ESMO Women for Oncology Committee and otherwise. So I think it is very meaningful, and many people would learn that what all efforts are in space, what and how people can get benefit out of those. So thank you very much, and thank you, Dr. Banavli, for this excellent moderation. And let me also tell you and put on records that he is one of those progressive men who always support women for oncology in the country and otherwise. So we are privileged to have you, sir. With that, I will hand over it to Priyanshi for next session. And Pilar, please stay with us for the panel as well after the inauguration.
We now come to an extremely important part of the summit. But before moving on, I would like to invite again Dr. Jyoti Bajpai to invite the dignitaries to inaugurate the event. Thank you. Over to you, Dr. Bajpai.
So thank you, Priyanshi, and extremely privileged to invite none other than Dr. Sudeep Gupta, sir, who is the Director Actuary, very senior medical oncologist, and also one of the force to support this cause. So Dr. Gupta, please, we would like to hear you some words about Women for Oncology and workforce equities.
So thank you very much, Dr. Bajpai, for inviting me to this excellent conference. And I had the privilege of listening to the last talk to some extent. And I think it's very relevant in the modern world to ensure that everyone, whether it is women or other relatively underrepresented sections of the society, that everybody gets equal opportunities, and there is no discrimination against, or at least there is no systematic discrimination against any group. I think your conference is an excellent initiative. There are several other initiatives that you have taken, that several other oncologists have taken. And I think in the long run, it needs to be a partnership between everyone to ensure that that there is justice and fair play in all aspects of our profession. And I'm hoping, and I hope that in a few years from now, and sooner rather than later, we will not need a forum like Women for Oncology, because our genders and our whatever we perceive as our differences will cease to exist in terms of our professional identities. That would be an ideal world where we are just known, and we are just accepted for what we are. We know that there is the world is not yet completely fair, and it is actually far from it. There are several inequality and inequities that do exist in our societies, in our professions, and so therefore, until those inequities are taken care of, and until they are eradicated, we do need conscious efforts to overcome them. And your meeting and this conclave of individuals who have thought about this situation is extremely opportune. And my congratulations to you, and once again, my best wishes.
So thank you very much for these pearls of wisdom, and we are really privileged to have progressive men in support of this cause, and I completely believe that together we can make a difference and make this world far more fairer than what it is today. With this, I would invite Dr. Jayakumaran. We already introduced him. He is the SARC Federation of Oncology President, and together with Dr. Gupta and Jayakumaran, we would like to have a virtual lamp lighting, and Mayur and Priyanshi for the further proceedings.
Shubham kurutvam kalyanam arogyam dhanasampadah. Shubham kurutvam kalyanam arogyam dhanasampadah. Shatru buddhi vinashaya deepajyotir namostute. Deepajyotir namostute. Deepajyotir parabrahma. Deepajyotir janardanah. Deepajyotir parabrahma. Deepajyotir janardanah. Deepo hartu me papam. Sandhya deepa namostute. O deepa brahma rupastham. Jyotisham prabhuravyayah. O deepa brahma rupastham. Jyotisham prabhuravyayah. Arogyam dehi putranscha. Matim swachham hi me sada. Raverastam samarabhya. Yavat suryodayo bhavet. Raverastam samarabhya. Yavat suryodayo bhavet. Yasya tishtet gruhe deepa. Tasya nasti daridrata. Shubham kurutvam kalyanam arogyam dhanasampadah.
Thank you. Best wishes.
Thank you so much, Dr. Sudeep Gupta, Dr. Jayakumaran, for sparing your valuable time and for joining in. So now we are moving to a very important and interesting session. So I would like to invite the chairperson of the next panel discussion, Dr. Anil DeCruz, Director of Oncology, Apollo Hospital, UICC President, and past Tata Memorial Hospital Director. Dr. Reena Nair, Senior Consultant, Clinical Hematology, Tata Medical Center, Kolkata. Dr. AFM Kamaluddin, Consultant Oncologist, SFO EC Member, Department of Oncology, United Hospital Dhaka. And Ms. Nishu Singh Goyal, Consultant Administration, Head Patient Navigation Cable, Department of Atomic Energy, Tata Memorial Hospital, Mumbai. Thank you. Over to you. Dr. Anil de Cruz, Reena Nair, is this?
Yeah, if Anil is not around, then I will take over. The next topic for discussion is real-world challenges for women in oncology. And after all the discussions and debates we have heard today, there is absolutely no doubt that we need a forum like this, and to come up with some kind of solutions more than just the discussion all the time. So Jyoti has very aptly chosen this to be at the end of the meeting today. And we have the moderator, of course, as Dr. Jyoti. I don't think I need to kind of introduce you to her formally. Each one of us know her as a name at home now. She is the professor of medical oncology and the secretary breast disease management group at the Tata Memorial Hospital. I have seen her through a student right up to the time she has become a professor, and she's done just a very, very excellent job, not only in oncology for the women community across India, and the passion with which she follows what she wants to do and taking it to a complete completion is her art. And for that, we all really admire Jyoti. Jyoti, will you like me to introduce some of the panelists, or should I leave the introduction of the panelists to you? So from here on, Jyoti can take over.
Sure, ma'am. Thank you very much. And thank you very much for these kind words. And let me also tell you and put on records that Dr. Reena Nair is one of those mentors, sponsored, teacher, everything to our generation of oncologists, and especially for me. We look forward for her advices, her candid opinions and feedbacks for each and everything. Whenever I start something, I go to Dr. Reena, and she is always a very, very strong support. Those kind of power women we require more and more. So thank you very much. And here, I would like to call upon the eminent panelist, Dr. Eva Seglov, who is a professor and director of oncology, Monash Health and Monash University. She is co-founder, Commonwealth Neuroendocrine Tumor Collaborations in Australia, and there are many, many heads. So Dr. Janice Singh, who is again ASMO, a woman for oncology core committee member. She's a breast group senior medical oncologist and very, very active as far as gender equity is concerned. Dr. Melinda, who's a medical oncologist at Royal North Shore Hospital in Australia. Again, these all have common interest for gender equity. Dr. Ellen Dole, who's a consultant for radiation oncologist at King Fahd, and she's again having a keen interest in women for oncology. Next, please. So I think we don't have Dr. De Cruz, but we have Ms. Goel with us. And the next panelist is with the Dr. Goel to introduce.
So I'll just complete this, and then Dr. Goel can take over the remaining panelists.
Sure.
Dr. Karima is the Associate Professor and Medical Oncologist from Sidi Mohammed bin Abdillah, Morocco. We have Dr. Abir Omer. She's the clinical oncologist from Khartoum Oncology Hospital, Sudan. And my very dear friend, Dr. Ritu Jain, a medical oncologist and bone marrow transplant physician. She's the director, bone marrow transplant and academics at the Jaslok Hospital and Research Center, Mumbai. And so we can't say that the women haven't crossed the glass ceiling with Ritu. I'll hand over the introduction of the remaining panelists to my next co-chair.
Reena ma'am, if you can just continue introducing this another 8 panelists, please.
Sure. So we also have Dr. Sue Chu, and we've heard her in the morning earlier today. She is a visiting consultant at the National Cancer Center, Singapore. Dr. Erica Gracia. She is the professor of gastrointestinal medical oncology department from Mexico. We have Dr. Salwa Sadeh. She is from the King Hussein Cancer Center, Amman in Jordan. We also have Dr. Nirmian Mustafa, lecturer of clinical oncology and early detection, Ain Shams University, Cairo, Egypt. Jyoti, I must say that the panel is really glowing with all so many glowing women. Yeah.
Absolutely.
We also have Dr. Narmeen Talibova. She's a medical oncologist, founder of Young Oncology Group, a co-founder of the Quadin Project of Women Health and Rights, Baku, Azerbaijan. We have Dr. Sandhya, Associate Professor and Radiation Oncologist, National Academy of Medical Sciences, Bir Hospital, Nepal, and Dr. Elizabeth Travis, Professor, Department of Experimental Radiation Oncologist from the University of Texas, MD Anderson Cancer Center, Houston, Texas. And with that, I hand over to Jyoti as the moderator for the real world challenges of women in oncology and most importantly, the proposed solutions today.
Sorry to interrupt. Now I would like to request Dr. Kamla Uddin to introduce the next panelists. So Dr. Kamla Uddin is there with us.
Yeah, thank you first, Jyoti, for giving me the opportunity to be part of this, historic event, I will rather say, in this region. So I would like to introduce, already we have heard from her, Dr. Pilar Garrido, who is Women for Oncology Committee Chair, Associate Professor Medical Oncology, University de Alcalá, Spain, and Dr. Rosania Barandi, Professor Medical Oncology, University Provincia Marcia, in Italy, and Dr. Zohra Zamila Khan, who is the Professor of Pediatric and Hemato-Oncology, Dhaka Medical College, Bangladesh. And Dr. Huda Basalim, who is the Vice Dean, Faculty of Postgraduate Studies, Director, Eden Cancer Registry and Research Center, Yemen. Dr. Tirusha Navaratna, Consultant Oncologist, Sri Lanka, and Dr. Georgia Deventrio, Professor of Clinical Oncology, Treasurer of South Africa of Medical Oncology Society, SASMO, South Africa.
Now I would request Ms. Nishu Singhal to introduce the next panelist.
Thank you so much, Priyanshi. And I would like to congratulate everyone who's gathered here today because it's an extremely thought-provoking and a very pertinent conference. And Dr. Reena Nair just took the words out of my mouth that it's really glowing. And it's my privilege and pleasure to introduce the panelists on this esteemed panel. I start with Dr. Solange Peters, who's the ESMO President, Chair, Medical Oncology, Oncology Department, Lausanne University, Switzerland. Dr. Narsjut Flores, Associate Director of the Cancer Care Equity Program, who's also thoracic oncologist in the Low Center for Thoracic Oncology, Dana-Farber Cancer Institute, US. Dr. Deborah Markiji, who is the Associate Professor of Clinical Medicine, Commissioner for the Lancet Commission on Women and Cancer, UAE. Dr. Jinan Abdullah, who is from Medical Oncology, Ministry of Health, Kuwait. Dr. Humaira Mahmood, Head Oncology Department at Nori, Pakistan. Dr. Nesreen Mejri, who is MD Abdurrahman Mami Hospital, Medical Oncology Department, Associate Professor, University Tunas Al Manar, Faculty of Medicine, Tunisia. Dr. Sana Al Sukun, Professor of Medical Oncology, President of Jordanian Oncology Society, Jordan. I welcome you all to be a part of this panel, and we look forward to all this interesting panel discussion.
So thank you very much for these kind introductions. And Priyanshi, can you allow me for share screen? Right, so is my screen visible?
Yes, ma'am. It is visible.
Right. So we shall be discussing in next, few minutes, rather I would say an hour plus, the real world unique challenges and proposed solutions as far as Women for Oncology is concerned. And I'm really glad today that how we thought about GLOWS, the Global Women Oncology Summit. And I'm really grateful for my organizing team, including Naomi and Mustafa, entire SARC Federation of Oncology group who really helped me to shape this up. And I'm glad for the support I received from all over, all of you. And put together, we are here today to discuss about the challenges as well as propose some solutions. And I believe that these steps will take us forward as far as gender equity is concerned. So in the panel structure, because there is really a glowing and elaborate panel, so there will be some general questions which a few of the panelists can answer. This will be general, whosoever wants it. There are specific questions which a few panelists would answer, as far as I have sent a question framework to you, so that everybody can participate in some or the other manner. Then there will be at the last again an open forum, a brainstorming discussion for all the panelists. And please be aware that this is not a watertight compartment. Active participation from all of you would be highly, highly appreciated. Now we'll move on to the first part. So these are general questions. And I would like to ask about the gender climate at your country or workplace. And because we have Solange Peters with us, we have Georgia, we have Zana Beradi and Narjust. The first part of the question about the gender climate at your country work, I would like them to answer, and then we take it forward. So as far as the women in medical workforce is concerned, the number of proportions, their managerial or leadership roles, and also very importantly, the behavior of men colleagues when they are seniors, companions, juniors, students. So Solange, would you please start?
Yes, thanks a lot. So the idea is to try to describe our local environment. So I'm coming from one of these countries which are maybe a little bit like Singapore, considered as being the wealthy, nice place where we hope progress could happen because we have very few or not so much as the other ones, financial barriers. Unfortunately, that's probably the other way around. I'm professor at the university in my country, in my city. This is the largest oncology center in Switzerland. In my university, 12% of the professors, 1-2, are women, while the young doctors are 70% women. So only 12 are professors. And I would say along the lines of the last 15 years, this is getting down. It was 17 at some point, now it's 12. Of course, COVID has led to an additional reduction on that, because women who are used to potentially travel to get a position in Switzerland will not do it anymore because COVID has put the whole family in trouble somewhere else. So this decline in number has to be at the time being observed and will probably be observed later down the road. So it's a drama. I mean, I live in an environment where the army and the male-dominated features are predominantly feeding my daily business. How do the men behave, right? Well, as you can imagine, in such an environment, right, decisions are made by men. Women are considered as being too nervous, hysterical, not productive. So that's probably the place in the world where I'm less recognized, my local place. So for everything I do, for everything I publish, for everything I say, it's a place where men dominate decisions, women are not listened to, and that didn't change over time. So they even tried to mount a group of gender diversity, but they feel like they have finished when they have addressed the question of maternal leave, right? So they have fixed it. And when it's fixed, they think they have fixed the gender stereotypes and the gender bias. But the problem is really the stereotypes. You read the CV of women through the kids, through the husband, through the part-time. So every little parameter you could imagine are still kind of treated with an old fashioned in my center. So if you want to come and visit, you will have a good example of what should not be done. And we do our best, but it's a very slow movement. So that's where I come from. And even in Switzerland, I think you're probably better in your center.
So thank you very much for this, very, very open and brainstorming, discussion points. I would say that things are really not the way it should be. And when we are talking about developed world, the developed centers. So the figures are alarming, and I already said, and I appreciate your vision and your work. We have to go a long way. So acceptance, which is the first point, we are challenged and we have to move. I completely have, thought echo whenever you speak. So now I'll move to Georgia, your thought, and then Rosanna.
Thank you. So, in the last 3 years, we've had quite a flux in our country in terms of leadership roles in oncology. We have 2 medical oncology departments, which are university departments. And there is a 50-50 split between the 2 different departments in terms of 1 female and 1 male head. I've just taken over as head of medical oncology at the University of Witwatersrand. So that's a 50-50 split for medical oncology. And we've got 5 radiation oncology units in the country where they train radiation oncologists. And of them, 4 out of the 5 are in fact headed up by female oncologists in terms of radiation clinical oncology. So we've already seen a huge shift in leadership roles literally in the last 3 years in the country. For the Society of Medical Oncology of South Africa, we have on our EXCO 6 members, of which 4 are male. We have 2 females, and I've just taken over for the first time in the SASMO history as a female oncologist at the helm of the society. So the change is coming, and we're very excited about the change because up until probably the last 3 to 5 years, we had a scenario where we made up probably 70% of the workforce and weren't really getting much airtime in terms of being invited for meeting sessions. And that's where, the collaboration ESMO Africa really has given a lot of opportunity to people to shine outside of what would have been our sort of male local role. Because we saw in some of the literature that was presented earlier in some of the speakers' talks that, in fact, probably Europe is forging ahead with about 40% of females presenting at meetings, whereas sort of in the Asia and South America, it's probably about 30%. So with, ESMO Africa partnering with our local societies, we saw more and more females coming to the fore. And that really does help us because it helps drive some of the people who are a little bit set in their ways to have to come along with that wave of change. I'm very happy to say that, in my department, we have more females than males, and we are seeing succession planning where hopefully down the line, we will have more disadvantaged members of society and more females coming through in the fore in our local environment. So it's not always easy. And I think sometimes we almost creep up on our male colleagues. They don't realize we've been there for as long as we have, and they don't realize the work that we sometimes do sort of in the background until eventually the results start to show. But I do agree with Solange that that's on top of all the other challenges. And I think COVID certainly placed a huge burden from a family responsibility, from a, having to worry about homeschooling while you're still having to go out to work. And who's going to actually be the one caring for the kids at home, and trying to balance every structure in the household as well as at work. So I think we have seen a bit of a drop off in terms of academic output, and I think that's probably where the challenge arises, because when academic output falls off, then the presentations at congresses, the moving up within the actual seniority with less publications also comes to play.
Sure. So we do panelists now, Rosanna, and then quickly to Narjas, and then we will move on to the other panelists.
Thank you so much, and good evening to everybody. Many thanks to Jyoti Baipai and to the organizing committee for this great opportunity of brainstorming. And I really congratulate with all the faculty for the speech. And of course, I'm here also on behalf of my colleagues of Women for Oncology Italy, which was initially created in 2016 with this aim, important aim that we discussed today, of consolidating the new way to create female leaders and to face with the challenges that there are linked to gender gap. I do believe also on the basis of what I heard today that there is still much to do to overcome the gender gap. And I'm giving you a few numbers of my countries just to reply to the questions. 18% are director of medical oncology department. So female director of medical oncology department. That means that more than 80% are male. And a similar percentage is for directors of hospitals, general director of hospitals. And if we move to the academic, we are 3 in Italy, full professors of medical oncology at university, which counts about 6%, which is a very slow percentage, very short percentage. But if we consider that about 2/3 of women are attending medicine, there is a clear statement that the pyramid reverses. And we carried on a survey as Women for Oncology Italy in our country that stated that there is a clear perception of the problem within the women, but there is no perception of the problem within men. And this is, of course, also a cultural issue, and there is much to do. As you know, a few weeks ago, the 2022 Global Gender Gap has published and certifies that it will take 136 years to obtain a real gender equality. And also, please note that 100 years were required in the same analysis, in the same dossier in 2020. So we are going worse, not better. And therefore, despite our feelings, we have to work harder. And Italy in particular was Europe, I mean, gender gap for Europe is 60 years, so better than the general data. But Italy is one of the worst even than Zambia and Uganda, which are clearly other countries that are out of Europe. So gender gap should be better in Italy, at least in our feelings. Therefore, I think that there is to do a lot of things, but I would also underline that it is not a matter of female gender. It is a matter of equity, because I have a son and I really wish he will not have to cope with these problems in future. What is now a difficulty for female, tomorrow it may be a critical issue for male, and this is obviously wrong. So we should do something in terms of education. So at the very beginning, starting to the very beginning and working together. So now we are working between female medical oncologists, but we are better working to obtain better results with other type of colleagues. So with an interdisciplinary approach, also with institution, but also with, for example, educators, but also with men and all the people that can contribute to make some advancement in these important issues. So thank you so much for this opportunity. I think this is a good way to start. In Italy, we say that to do 1,000 miles, you have to start with one. So this is a great one.
So thank you. Yeah, absolutely. And, you know, figures are again alarming. 100+ years if we require, then we really need to start not only taking baby steps, but perhaps we need to do, you know, running fast. And I'm glad that, you know, everybody is having a will and wish, and we are ready to join hands. So Narjas, your opinion, and for the second part of the panel, then I will ask the other panelists. So Narjas, are you there? Okay, so then I will ask, so Jabara, would you like to comment upon, do you feel equal opportunities to raise the ladder? And what is the most important obstacle? And for these 2 questions, I'm having my other panelists, Eva, Nermian Talibova, and none other than Pilar Jaridu.
Thank you very much for the wonderful gathering virtually and this fantastic participation of really inspiring women all around the world. I think with the question about equal opportunities to raise the ladder, this is when the whole equity question is there, because unless we have this gender neutral environment to work in which individuals, I'm not even going to say women, that individuals are valued for the skills that they bring to the table, and diversity is valued, and women and men who have other responsibilities, including childcare, and do what we want to do, which is improve patient care to tackle these really difficult problems in global cancer control.
So equal opportunities are not there currently, as we've seen from the data. I'd really love to see this group produce more data from low and middle income countries and to work on those solutions, because I think we need to learn from places like Tata Memorial, where we have colleagues who feel this is a gender neutral environment, and see how we can translate those to other situations and perhaps have gender sensitive policies, or charters or things that other institutions can sign up to. So let's think about, all think together and brainstorm about how we can move this forward as a global movement.
So thank you very much, these very pertinent comments, and I would move on to Eva for your comments about your chances as equal partners, or what is, if not, then what are the most important obstacles? We have Eva with us. I have seen her some time back, or meanwhile we will move and then we can come back again. Or Pilar, if you are there, I mean.
Yeah, I'm here. Okay. My opinion about if I feel equal opportunity to raise the ladder, I think it was Dr. Flores who mentioned that it's important to have numbers, and I try to present some number in which the answer is clearly no. So currently there are not equal opportunities, at least at the end of the ladder. No? So I could say that it's important to educate young generations, because at least in my opinion, most of them they think they are equal. So when you realize that the opportunities are not the same, probably you are not young enough to fight in the same way. So I would say that we need to keep collecting data. We need to push about the relevance of data, showing that the career is not, we don't have the same opportunities, and think globally, act locally, no? Because I mentioned at the beginning, and it's the idea of the Small Women for Oncology Committee, there are different things that can influence the ladder, no? The problems related to cultural aspect, another, not only gender, and all of them are relevant. As already mentioned, diversity is relevant and should be taken into account. But for me, the key point is to engage young people and to show them that this is not a problem of my generation or all generation. It's a problem for them too, because at one age, probably due to things like pregnancy or whatever, most of the women lost the career opportunities, and then it's not easy to come back. So they have to be involved, apart from, as mentioned, and Solange said, to involve not only the bosses, but the administration. But my key message is continue showing data and performing studies that purely demonstrate the differences.
Sure. So we have seen, the data. When we talk about the data, we have seen the ESMO study, which was presented prior by Pilar as well. And this is the, Deborah was talking about the lower middle income countries. So this is the Indian large survey report, 300 plus participants, majority of them were women, but they were men as well. And again, the figures are almost equal, whether it's a European survey or from India. So there are challenges, definitely, when we talk about objectivity. There are challenges, and at times it is not perceived. At times, the perception is very subjective as well. But when we take it into account, the objectivity, we found that there are, although women in medical schools, they are equal partners, they have 50% or even at times more. But when they rise the ladder, the dropouts are much common as far as the women are concerned. And in the managerial positions or leadership positions, we really have to go a long way, irrespective of which region, whether it's a developing world or developed world, there is a large gap. Also, as far as the journals are concerned, a fraction, only 26% articles have a female first or corresponding authors. When we tried to do this kind of analysis from our lead Indian journals. So figures are alarming. We will move now about how to break glass ceiling and stereotyping issues. So I will ask my other group of panelists. So we have Erica who's with us. We have Sana, we have Namian Mostafa, who's my core organizing team, as well Elizabeth Travis and Rosanna Barati. So so we will start with Erica here. How do we handle the stereotyping issue, and how much this problem affects you?
How the problem affects me, how to break the glass, that's a question?
Yeah, absolutely.
Oh, yeah, well, as Dr. Pilar said, I never realized that this world has a lot of inequity for women until I finished my fellowship. It was, since then, every day, as everybody, as all of you, I've been struggling in a lot of different ways, trying to follow my dreams. And I think that the best advice is that even though we can face many difficult people that they don't want us to go and have a power seat, let's say it that way, I would have to stay. We have to work, even though it's not easy. I was really surprised that Solange said that even in Switzerland, there is a lot of problems. Normally, we thought that Europe, it's more advanced in this way, but no, it's not. Since some months ago, we have made a survey here in Latin America, trying to have these numbers that you already mentioned. It's important to know what's going on in our regions, and what we have what we have saw is that there is a lot of imbalanced life for women here in Latin America. I can tell you that most of the women that we have asked, they are between 30s and 40s, and half of these women, it's like 150 of these women doesn't have child, even myself. And I think that this has been a response to all the difficulties that we have trying to have a better place in our medical society. So I know now also there are some other problems, like there are many young people doesn't want more responsibilities. That's another issue. But I think that many of us have this imbalance trying to reach our dreams. So it's very difficult. I don't have the best advice, only what I already said, that we have to follow our dreams, no matter at what cost we have. But at least here in Latin America, we try to do that because our society doesn't help us really. And nowadays we are trying to do this kind of group with more women, but this is just brand new. Maybe two years ago, we start trying to do something. So this is very, very new.
Absolutely. So I understand this, and this is definitely an issue that when we are at early part of the career, the problems are not so much explicit, I would say. And while somebody is really trying to raise the ladder, this is competitive world. At that time, perhaps the resistance is more. And as women are rising the ladder more and more, they are experiencing more and more resistance. That is perhaps the experience which I find in surveys, in individual questions. And that's what, at times also there is, differential resistance. And if, at times in an institute, the higher management is perhaps not so much resistant, they are rather facilitators. But still, women will face problems at middle level or at even low levels. So it is a differential resistance at different levels and different time of their careers, which one face. Dr. Sana, what is your comment on this? we had Sana Alsacom join with us. Or maybe Narmian, can you take it and then we'll come back to her? Is there a problem with the audio? Because I have seen Narmian just now. Or maybe we'll move on to.
Yes.
Yeah.
Yeah.
We just heard you.
Thank you so much, Duty, for your great efforts and for gathering such great names and eminent figures in Women for Oncology. And I personally inspired a lot from you. Really, you are inspiring me in all your actions. And regarding this topic, how to break glass ceiling, being Egyptian and from Arab country where we are in a male dominating environment. You know, by default, men are natural leaders. It goes without saying, we are always play an excellent role, but usually in the second role, in the second man role. It's unacceptable that the leader who will give the orders and is female and men who are working on our orders. So by these efforts, we are trying to change this concept. And you inspired us by the survey that we are working on it now in Egypt. We are trying to know our statistics, and the provisional data show that significantly we are underrepresented in leadership positions, in authorship positions, in speakership position, especially in certain specialties in oncology, GIT, GU. Maybe we are a little bit dominating in breast oncology, but in other specialties, we are significantly underrepresented. So we are trying with all our this marvelous global efforts to break the glass and break the ice and make our position in the leadership positions.
Sure, I think you made really very important points. So I would quickly move to Rosanna. What is the importance of networking? How to improve, opportunities by networking? And if Solange, you are here from car or airport, I would like to hear you also on the networking issues. So Rosanna and then Solange.
Can I add a comment, please, Duty?
Sure,
I recognize that the whole organizing committee for this great meeting is female oncologists. So thank you for your this effort. You're trying to make, and I think you made it marvelously.
Thank you very much. Thank you very much, Nobin. And I would like to acknowledge your contribution as well. And yes, this is an event which all the women, they organize, and we want to hear our voices, which should go a long way. So do we have Rosanna and Solange? Otherwise, I will...
Well, I do think that our role is important also to help younger women, and this can be made through networking, firstly, but also promoting activities, stimulating on the importance of support female medical oncologists in their career path, also helping themselves to create networking and reconciling private life and work. These are tricky points, and I think that is important to promote also networking with other associations that may support women. For example, in Italy, we are working together with Women in Surgery, which is another association that is strongly committed to the help to physicians, female physicians. Another point that I would like to underline is that pandemic maybe has increases our difficulties. During pandemic, we have promoted as Women for Oncology Italy a survey that we have published on ESMO Open, which was focusing on social distress among healthcare professionals in Italy. And that showed that the social impact during this health emergency was stronger in female medical oncologists, because we also have to support our family due to culture issues, but also for our our way of thinking life. So we are strongly committed also with our parents as well as with our sons and daughters. And all these points reflects the need, the real unmet need to implement networking. And I do believe that this is the time to do this, connecting not only, as I mentioned previously, medical oncologists, but also all women and men that are involved in education and career, as well as in other disciplines.
Sure. So do we have Solange with us to comment upon networking? Otherwise, we'll come back again and we'll move on to another question.
I'm sorry, Dr. Solange Peters is saying that she's here in the chat, but not as panelist. Can somebody give her?
Sure. So Mayur, can you just upgrade as a participant? So Solange, can you please comment upon the networking?
I'm here again. Can you hear me?
Yeah. Yes.
Yeah. I just was moved as panelist.
So the question is that importance of networking to improve the opportunities. Mayur, did we again also?
Ma'am, she is there. She has to unmute. Dr. Solange,
Solange, can you please unmute?
Okay, can you hear me?
Yeah. Yes, ma'am.
Yes,
absolutely. Perfect. Sorry, I started to speak alone. I think the networking story is exactly well described by my colleagues. There's one thing maybe in the networking that I would like to stress is somehow in creating initiatives, mentoring and so on, is the importance of networking to find the courage to move. I was speaking about Switzerland, right, where everything is supposed to be absolutely nice, clean and perfect. And if you sit or you stand alone trying to defend this kind of causes and argue, it's going to be very difficult. So there's one thing in the networking, which is about understanding that all the considerations we feel, experience are shared. So it's not only our perception, but it's, I would say, a societal perception. And the other thing is also to be able to phrase it out or maybe even write initiatives together in order to make sure that we have only one voice. And the networking has started like that for me, just trying to understand how we can be together in trying to bring initiatives. Very importantly, we should never forget about the women's networking, because I don't know about you, but what I observe in my environment is too often the networking in women is great, but not when it's about competition. Suddenly, and Narjus said, NG said very nicely, that she always gives name of women when she can. But we do not all do that, right? We very often do not sufficiently support other women. So networking is not only about supporting or being together, it's also about identifying in the community a series of names, a series of key opinion leaders, professionals that can be the ones you will propose. And you also need to keep in mind that you need to propose them because nobody else will do. So networking is also creating your registry of who can be the women you will propose when the opportunity, every time the opportunity happens, right? So it's of key importance.
Absolutely. And, you're absolutely spot on while saying promoting other women, supporting, hand-holding. At times this is seen that, when a woman trying to, make her mark, trying to raise a ladder, the senior colleagues, senior men colleagues were also not that supportive. Senior women colleagues were also not that supportive. And that creates a really hostile environment. So I think we should be really conscious, and we should be consciously and subconsciously try and promote the fellow women colleagues. Also, if there are some situations wherein you need to handhold or you need to support for a right cause, of course, you should come forward. And perhaps here we need to make a progress. We have not so far done that great as we could, especially the women who reach to a power position. Perhaps it's our responsibility or, kind of, duty towards a fellow colleague to give more opportunities. So
you know, Jyoti, by the way, there's nothing guilty to feel about that, because this is a paradigm of minorities. When you are part of a minority, will it be racial, religious, or gender? And you know that there is a limited number of seats for women, because we all have to admit there is a limited number of seats today for women, that we all tend to be the one from the minority to have the role, right? So this is something which can happen when a minority is defined by strong arguments, which is very rare, but it can be political party, for example. But this cannot happen for gender or race, because there's no minority which has to be treated like a minority. But the reflex is nothing guilty, right? It's something which is almost intuitive when you know that the number of seats are not 20, but 1. So, but we just have to think about it twice.
Absolutely. I think these are very, very important points, and these are the lesson learned, and we have to move forwards after learning these things. So now for the next question, how to survive in political world. So these were the panelists who were supposed to answer for this, and under this heading, I have framed a few questions like how to navigate discrimination, whether it is subtle or overt. And perhaps maybe we can start with Su Pinchu and others who have not spoken. Salva has not spoken, Narmin Telibova have not spoken, and Sandhya has not spoken. And then we'll move on to the others who have already spoken. So do you feel lonely if you stood up for right cause even in your country, institute, environment, and feel free? I think nobody will take it other way around. It is an open discussion, and this is for everyone. And also, have you faced ganging up against by male colleagues, by juniors, by contemporaries, seniors, and how you navigate that?
So I've been fortunate that I've never faced anyone ganging up against me in a big way. But if you want to stand up for a right cause, I think you need a pretty thick skin, and you need to pull people on your side. I think whenever you want to run if you want to make a statement or you want to make a change, you can't do it alone. You're more powerful when you have a group of people behind you and supporting you, and convince the group of people to be with you and be your fellow advocates in whatever the cause is. And I found that has always worked. And I think it's being smart about it, and being pretty thick-skinned about it, and not being afraid to ask. Yeah.
Right. So do we have Salva with us?
Yes, I'm here.
Yeah.
So
Salva, would you like to comment upon
yeah.
these issues?
So I think it's the type of discrimination or the type of gender bias is very social specific. So different countries, different societies, different races and origins, you will face different things. So in Jordan, for example, I think the most part is not the overt and upright discrimination as much as subtle discrimination that's just kind of embedded in the society as a whole, not in oncology in specific. Males are always regarded as dominant, female voices are less heard. That's one thing. Females are always, so you have to put that extra effort to prove yourself, as opposed to males who just come into the workplace or whatever new position they come into as being viewed as someone who deserves to be there. Females always have to prove that they are not less of physicians, not less of oncologists, not less of colleagues. You have to put that extra effort to prove yourself. And that is subtle discrimination, subtle gender bias. But sometimes even females don't recognize, they do not recognize that they are being biased against. So I think the first thing is to
absolutely. So I can, right. So I think you are absolutely spot on when you're saying that at times we do not even recognize. So when there is a subtle discrimination, at times women even do not perceive it. And they feel it is kind of normal, or accept that their tolerance is much higher. And also they at times look upon the fellow male colleagues or the senior colleagues very high in the ladder. And that's how they feel that those subtle discrimination is okay. So that, and they even subconsciously feel there is no discrimination. So we have to really consciously ask us ourselves that are we really, equal? Are we getting really equal treatment? And if not, why? And if you realize that, then do you confront? Is my next question. So do we have Narmian Talibova with us now? Or Sandhya?
Yeah, hi everyone. Thank you very much for excellent discussion. I'm a medical oncologist from Azerbaijan, and I had a leadership experience in my career life, and unfortunately it was not easy for me, and I always, face a situation where the male ignoring me always, and when you are young, when you are a woman, and it's really sometimes difficult to prove yourself, and you have to do a lot to prove yourself. And unfortunately, in my country, to become a woman medical oncologist is very difficult because we don't have a lot of educational opportunities in my country, and so you have to travel a lot. And if you have a children, it's really difficult to find person who will take care of your children. And during my residency, it was really difficult for me. And today I'm on my way to Germany, and I think one of the reasons is that difficulty in my country, especially for women oncologists. And I think we have the main problem in my country is cultural problem, and is a networking problem, because in networking is much more good between male oncologists than women oncologists, and they support each other. And when you are a woman, and you always feel yourself alone. And thank you, really, you inspire me, and I think it will help me in my future career. Yeah.
Absolutely. So we need to handle each other, and that's the way forward. So the next point, did you or maybe any of your colleague, you have seen it, a situation where in a position, a promotion is favorably offered to a much junior male colleague, ignoring a woman's contribution or skill set? So maybe
Yeah.
I think Namin or Sandhya, anybody can take Namin, Mostafa or Sandhya can take it up.
Yes, Jyoti, yes, I think we
Yes.
can give the mic to another panelist. Karima is raising her hand. I think she wants to say
Absolutely.
something.
Please, I'm not able to see all the panelists because my screen is with my slides. So definitely, I would be happy to come.
Yeah. Yeah, Karima.
Karima, please go ahead. Karima, are you there? Or otherwise, Erika is for this question, and the next question is as such entitled for Karima.
Yeah. But first, can I say something about last question?
Please go
Thank
ahead.
you. Because I would like to address that aggressions or discrimination doesn't come only from men, also come from women, and even worse from the patients. And I think that obviously education can make a big difference, but it's going to take some time to change the mind, for example, of the patients. And maybe you all have lived the same as we, that they call us, Miss, like nurse, but not referring as a physician. So these subtle aggressions, we need to change it. And doing like these kind of meetings as the one that you have proposed, thank you for the invitation. I think we will try to do some changes. And the other thing that I want to say is that the real discrimination, the biggest, the strongest, well, I think we need to have a thick skin and work harder, as obviously we do it every day, because we have to show that we can do it in a better, we can have a good results, even though we are women, even though we have to take care of childs or older elderly patient, elderly family. And for that, we need numbers, and maybe a generation, maybe this generation, to work hard for the youngest. That's my point of view.
Absolutely. So very well said. And with this, we will move to the other question as the clock is also ticking up. So importance of collaboration with international and national societies. So this is a picture where an ESMO Women for Oncology initiative, the 2021, I'm privileged to be part of this eminent group. And let me tell you that there are a lot of progress and a lot of, discussions and, projects are being taken up, and, ESMO is also working as a, a central part wherein wheels and spokes kind of fashion. The other regional societies are also combining and joining hands. So I think it's a very good role model. So for this particular question, the importance of collaboration between international lead societies and regional, why it should happen and what benefit it can bring. These are the panelists, and anybody can take it. Again, I would like to ask who has not spoken so far first, and then we'll move to others. So do we have Nasreen with us? Do we have Jinan or Humaira? Or Sana? Sana, are you there now?
No, she's still, she's not available. And
okay, fine.
Yeah,
so
Karima,
now just so who is there?
Karima,
Solange,
yes,
are you there? Solange, are you there?
No.
Yes, I'm here. I'm here.
Yeah.
I'm here.
So I think your comments upon,
yeah. So I discussed it before. I think the national level is really important because some things can only happen where you are. Some practicalities, right? When you think about convincing the direction of your hospital that going to 100% again makes sense, then maybe your scientific research is worth protecting some of your time, or even constructing a childcare is needed for many doctors who are missing one. So all these kind of things, unfortunately, ESMO or your national society even cannot really do. You need sometimes to have the granularity of the local place, the local environment, supported by, of course, the national law. So I guess the national societies, national groups are essential, but more than that, even conveying messages to smaller group, regional groups might even be needed. So nothing can be really done apart from political theory on the ESMO point of view. We can, of course, have speakers, women speakers, but still these women have to do their career at home, right? When we identify women speakers, most of the time is because they have been successful in making their way locally. So we still need that locally lots of things happen. So we rely on the local network to make this woman happen to be known and to be promoted. So ESMO is more a political, theoretical background. The other thing which is very important in the local environment is, of course, the support and potentially the investment, right? You will probably need some money, to have dedicated fellowships for women, dedicated projects, and even some political initiatives. All of these need that you have support financially, structurally, and this can only be done nationally. So I think more and more we would need, as Women for Oncology in ESMO, to, if possible, have as many Women for Oncology group as national societies. It's not the case at the time being, right? So it's really some things that will make the things concrete, right? Step by step in every location. And again, like it was told before, it might be that the worst locations are not the one we expect, right? So every little region has to make its own move in making the things change. So be committed in ESMO, be committed in organization ACR City, but never forget that you need to be even more committed locally in having these initiatives making concrete move, right? So that's really where national, even regional initiatives are needed.
Absolutely. I think everything is having importance, and the space is really wide, the gap is really wide, and there should be more and more momentum come together for one single cause, and then perhaps we can make faster progress. So with this, we will move on to another question, how to say no effectively. It was very eminently presented by our speaker, but now we will discuss. So these are the panelists for this question, and I will give certain scenarios and people can take it up. So when you are dumped with extra or relatively less important work, how to say no. When you as a woman offered less pay for same level of work or skill set, how to say no and put your foot down. Also, why this happened, what are the biases, etc., and attitude of your colleagues, women, men, about these things when you say no. So I'm having these panelists with us. So Eva, are you there? And then Janice and Melinda. So anybody in any sequence, we can take it.
Well, Jyoti, I'm here. I'm Karima.
Yeah, please, Karima, go ahead.
Yeah, just to make the bridge with the previous thought from Professor Peters. So I really personally want to thank her very much, because thanks to ESMO and the opportunities that ESMO offered us in low income countries, I really was able to make a lot of fellowships, a lot of trainings in Europe, outside my continent, my country. And it's thanks to this that we gained more experience, and we are more and more recognized in our oncology community, which is male dominated. And I think about how to say no effectively. I think the main reason for all of us that we are shy or unable to say no effectively, because we are not in most of cases in leadership positions, because okay, we are good oncologists, we are working hard, we are doing great work every day for our patients, but about leadership positions, it's most of time male dominated, and that's why we have this, less power to say no to everything when you are under evaluated comparing to male doctors. So, but I think things being in a low income country, I think that things are really improving in a very good way, and we hope that with near future we will be involved more in leadership positions. So and this can be also deeply encouraged by such community, such work that we are doing now with this meeting. And I hope really to involve more and more low income and middle income countries in such projects in the future, because we have special context. Thank you.
Right, so do we have any other panelists with us in the group? Janice, so I'm seeing momentarily some people, and then
yes, thank you, GOT. I think something that's special for this meeting, especially for India and Asia Pacific, then firstly, I could think about in our culture, we are taught, especially in Chinese Confucianism, that we cannot say no to anyone. So in terms of like courtesy, socially appropriate, so it's always need to be nice. And actually what Solange is talking about, this paradoxic opposite paradox for leadership. So I think it depends on various stages of our career. So I would say if we are at junior levels as fellows, maybe to doing something extra or less important, it's okay. As what Solange has pointed out, because as women, we are always obliged to prove that we are okay to take more responsibilities, to take a bit more, to look after more. But when it comes to middle level or at leadership levels, I think it depends on how we talk about the unmet needs of everyone and the unmet needs of ourselves as well. So saying no is actually not something that's really negative, but also to show our focus, to show to people that we have our priorities, as what Supin has actually talked about. So it reflects our maturity, and also the fact that we can speak at same levels with our working partners and colleagues. And it comes back to the unconscious minds, perhaps in the Chinese or Asian culture, or even with our personal growth from our childhood journey, when it echoes, when our parents, our teachers taught us not to say no. I think we need to overcome this authoritative barriers. Being able to negotiate and to speak the truth about ourselves is as equally important as a kind of maturity, and also as an element of important caliber for leadership, rather than being rebellious. So I think it's a balance that needs to be rehearsed. It's a muscle that we need to train up. So the say no muscle it's actually very important for us to rehearse, and to train up this say no muscle.
Yeah, so very well said. No muscle, say no muscle is really important. And as we know that when we use a muscle 1,000 times, this becomes a muscle memory. So practice, and the thing which is not in your favor, which is not right, which is making you overburdened, you need to say no. But you need to learn to say no effectively and politely, least upsetting. I would not say not upsetting, because perhaps that is not possible, but least upsetting. somebody. Do we have Abir, Omar, Melinda, or Ritu with us?
Melinda's here.
Yeah, please, Melinda.
Hello.
Thank you so much for being with us so late at your time. I'm really sorry, but when we are trying to combine 20 countries, it's become difficult for me.
No, it's a problem we have commonly in Australia, being on an island. Thank you so much for having me. A comment I wanted to make earlier around the way that we treat each other from a gender point of view, and I agreed with Erica, I had my hand up at that point. Actually, women can be very critical of women in oncology, and I think that's changing, but I would say that it may be because we've felt that we've been competing with men, and actually some of the dynamical relationships I've had in the workplace as an early career thoracic oncologist has actually been more with women being difficult on each other. So I think that that's something important, and I think we're preaching to the converted being here on that point that it's changing. So how to effectively say no? I laughed when I saw this because I'm horrible at it as well, and I was interested to see our speaker comment on it. And I think it's, as we just heard, it's ages and stages of career. It is very difficult in Australia to have permanency in your position in a public hospital. You're on 3 monthly fractional appointments. I'm currently with a toddler and having twins, so that's hugely anxiety provoking. So it's actually can be very difficult to say no to opportunities as you constantly feel that you're insecure. So I think with confidence as your career evolves, I hope that that will change. And I think the main decision I make on whether to commit to something or not is to basically, as an overcommitter, is to make sure that I'm not overcommitting and under-delivering. And I think, and also looking at what's for personal gain for you in a commitment as well as the greater team, because sometimes you need to obviously take one for the team. But I think it's interesting, we start reaching a tipping point in our career when we can start to say no more confidently as we have security in our workplace, and also as we start to see impacts, of course, on our family and personal lives, where we realize that, we need to change our balance. So personal reflection is key. So those would be my thoughts around to say yes or no.
Absolutely. So very well made points. And with this, I would again ask, do we have Ritu Abir Alam with us, or we'll move on to the next?
Yeah, I'm there, Jyoti. Thank you.
Ritu, please.
Hi. Wonderful evening, Jyoti. Thank you for this opportunity. And I would agree with Janice. Actually, as listening to all our colleagues all over the globe, I feel we were lucky that we had a gender neutral gender training at Tata, and I was equally fortunate that my working place, I had a very supportive male colleagues and even a management. So, fortunately, I have actually not personally encountered so much of resistance. People have been very, supportive. But yes, definitely, being females, as Dennis said, it's a cultural thing. We are upbringing. We are as children, we are trained to say no. So, and as Dr. Purna Kurkure rightly pointed out, that we should not be feeling guilty. Why is only the looking after the child care or the home is our responsibility? The men also should have an equal responsibility in that. That is at the home front. At the work front, I think we need to build a strong team of males and female, and we need to support each other on each front emotionally also. And we have to be there for each other. That has been my experience, that we need to build a team at home and we need to build a team at workplace. Then only we'll be able to navigate. And more important, like to support our juniors, and to be there for them to have a mentor, because we had Dr. Inan for us. So we are trying to, be the same for our junior and our female colleagues also.
Right. So when we hear a no from our junior colleagues, we should not be really annoyed. And when we need to say a no to our senior colleagues, we need to make such a team that it should not be very much annoying. Also, a very important point is never ever upset your queen or king. That simply means that, one person or a team of person or group of person wherein your major interests are involved, you try not to upset them. That is one of the point. With this, I will move on to the next section. This is the importance of mentorship and sponsorship. Pilar has given a great talk on this, and the panelists, including Pilar, are Rosanna, Johara Zamil, Huda, Tirusha, and Georgia. So anybody can take it. Those who have not spoken, I would again like to give the chance them first. So can we have Tirusha, Huda, or Johara speaking on this?
Hi, very good evening for all of you. It's a nice program, and it's very interesting talks from different oncology leaders in different part of the world. It's very impressive and very interesting topics we actually discuss and we listen today. And when we discuss in our country, we actually in oncology sector, we don't see much gender disparity, but when we consider our work, oncology work with our household work and other responsibilities, definitely there is a gender gap, because we have to fulfill all the other requirements while we are involving in our work. So it's very important for us to have a mentorship, not only to develop our professional career, to balance between the work and the extra things, and also to have keep our well-being. Also, we need a mentorship, and it's very useful actually.
Sure. So can we have a quick comment from Johara, if you are around, for importance of mentorship, and especially the distant mentorship? In today's world, pandemic has made us learn that if you can't be traveling, logistics, economics, then you can have a distant mentorship. We are from the GLOWS. I would like to announce this. I was thinking to announce it at the end, that we are making our pool for potential mentors, and all of you are most welcome. Many of you have already given your consent. Those who have not, I urge that please be part of this pool and spread this voice, so that we can have more and more mentors who can benefit more and more mentees, and we can work it out in parallel with ESMO, ESCO, SIDSI, etc., who are also running such programs, so that there can be more people who can be benefited with such distant mentorship program, which require much less logistics, much less cost, etc. So do you have any specific comment, Johara?
Regarding, thank you,
mentorship, importance of mentorship. Do you feel distant mentorship is important?
Of course, yes, I do feel the mentorship is very important for our female oncologists. But people said that I am a mentor, but I am not gender biased mentor. I do my mentorship for all of my junior colleagues, those who are male or female. It's not important for me. And personally, I should say, I never feel any biasness or any discrimination, very seldom, from my male colleagues. And it's rather, I feel sometimes a disparity or less cooperation from my female colleagues, sometimes, not from my male colleagues. Actually, it's in this century, it's this type of gender gap should not be exist. If we are care about ourselves, what to do, and take care, self-care, and not try to say nicely, know what we can do, and don't take more load of work, and do our work, which one I like to do, which one I love to do.
Sure.
So being a pediatric hematologist oncologist, I have to choose 2 or 3 or more, 4 or 5 diseases in our country perspective. But in these settings, we have to see many hematological disease, many oncological disease. So we are stressed. We can't we can run leadership or mentorship appropriately. So we have to figure out our program personally. Thank you.
So
Thank
we
you
have,
very much.
well perceived your comments, and we will move to the last part, because in the interest of time as well. So Pilar, this paper from ESMO, Women for Oncology Forum, again has shown COVID-19 has further widened the gender gap, and other issues, mentorship, we have already spoken. So now we are towards the end. Any comment you want to make with regard to pandemic situation, with regard to distant mentorship, Pilar?
No, I could say only, thank you, Jyoti, again. I could say that both are needed, no? The mentorship is, strategies and also the sponsorship. But I think it's quite relevant to remember that in general, women are over-mentored and under-sponsored. But to be a sponsor is not so easy as to be a mentor. So from an international perspective, we can work on mentorship strategies at different levels, but probably the sponsor one is more one-to-one. At the same time, I think that when, at least for me, I thought that mentorship was the standard one, no? One adult or senior to a young, but also remember that there are other kind of strategies also very rewarding, like the peer mentoring, in which you can learn from another person or people in a similar age or experience, something like that. So there is a lot that can be done in this area.
Sure. So we are towards the end, and I would like to hear from any of you, any other burning comment, issue. Anybody can take it up. In the last panel, there was Georgia, Erica, who were left. Soland, if you want to.
Yeah, Jyoti, just one thing, we are about publishing, like Pilar was telling, a new survey of members of ESMO, just trying to describe what they experienced. So we have, I think, discussed everything today in details, and it's very nice. But there's one point we did not discuss that I just would like you to keep in mind and maybe rise in your community. It's a little bit about the saying no, but this survey will show that many women describe the fact that they feel aggressed or injured in their integrity at the working place. Of course, the main thing coming on our mind is sexual harassment, but there are many formats of harassment, right? Which can be, of course, very obviously sexual, but can also be the daily business, right? Which makes you feel less than your value, or makes you feel, I would say, in a guilty situation or in an incompetent situation. So we have to be very careful about it, about saying no. You need to have a team around you who is able to identify with you how people behave, and how they should not behave should be denounced in a way that you are not alone, but the whole group has the same kind of moral values. So be aware, or try to have around you friends, people who will be there to judge with you and support you once it's about telling no, not in science, not in working, but about behaviors. Because it's very difficult to speak about behaviors, but we need to start to do that, because a survey that has been done by ESMO is stressing a growing number of people complaining about harassment. So I think that's, for me, a priority, trying to be able to find the words to tell no in these situations.
Absolutely. So I can't agree with you more on this. And my thoughts on this, that this is such a critical point and issue. We really need to objectively record this. And when we have objectivity, perhaps we can bring some more change, and some solutions perhaps can be proposed. So you're very right. Many times it is subtle. It is not, that overt, but to constantly make you feel little less is a feeling which is very, very, upsetting and distressing. So we should be definitely be aware about, and try to, lessen that, try to, oppose that in a team. So very well said. Anybody else want to make any comment, and then we will perhaps go to the end.
I just had a question to the groups. Oh, sorry. This is just Mel again from Sydney. So we did touch on the inequities in pay and secure working opportunities that perhaps exist throughout for women. What I still grapple with is, how do we truly address it? And how do the experts on the panel feel that we, I guess, bridge that gap? Because acknowledging it is so important and speaking up about it, but the next stage is something I struggle with.
So
I might have a short answer about it. There was a nice, it was in Finland, in these Nordic countries in Europe. There was a nice movement. It was an experience, an assessment. They asked the private companies in, I think it was Finland or Norway, I don't remember, to report on their potential pay gap. So to report on a regular basis, on a yearly basis, what were the salaries, because the pay gap is very easy to calculate, but to report it spontaneously and regularly to the authorities and to the public. And once you start to report, because it's a kind of a shame, but it's also sometimes a kind of a conscience that you make yourself aware of, right? But if you ask as a fundamental that these numbers are given on a regular basis, it's already a movement toward a better situation, a corrective way, right? So the first step is really to make sure that these data are made available in public quite often, because it already makes the thought happen and sometimes a correction to start. So it's interesting, it was the private companies, but since they had to report, they started to correct the movements. So maybe that's a starting point.
Yeah, great, thank you.
Right, so I think with this, we will move on to the, towards the end. I think this is such an interesting and intense discussions. We can go on and on for hours, but we have finite time, and we need to complete today's first GLOWS summit. So I will give a few of my takes on gender equity. These are the few pictures which are saying what I really meant. What is time that we all see gender spectrum instead of two sets of opposing ideals. Next time you are about to call a little girl bossy, say instead she has executive leadership skills. Perhaps we should be intervening very early on, and then perhaps we can see a change in the society itself. Culture does not make people, people make culture. If it is true that the full humanity of women is not our culture, then we can and must make it our culture. Men are from earth, women are from earth, and deal with it. So these are a few of my takes, and with that, I'm really, really thankful to all of you for your great contributions. And with this, I will end this panel here, and I will hand over to Priyanshi again. Thank you very much.
Thank you so much, Dr. Jyoti Bajpai. Now I would request Ms. Nishu Singh to give closing remarks.
So Dr. De Cruz couldn't join still, otherwise we were asking both of them to give the remarks. So then Ms. Goel from your side.
Jyoti, first and foremost, let me congratulate you on such an important and a thought-provoking conference. It's been a privilege to listen to the ideas and experiences shared by everyone on the panel. I really don't have anything to say except maybe just capture some thoughts together, which have made a lasting impression. All of it was relevant. Gender inequality does exist. It exists through all spectrums of society. Unfortunately, in a progressive field like medicine, if it is existing to the amount and the content that has been shared, it is sad. And we all need to do something about it. 136 years to obtain gender equality is alarming and very distressing. Also distressing is the fact that women have to sacrifice their childbearing years and give up the privilege of in order to be achievers. That's also equally distressing. However, as someone rightly put it, that the journey of 1,000 miles starts with a single step. And that's a single step of creating awareness, accepting this as a problem, because I think what's also important is that we've not been able to recognize these signs. And the whole aspect of, over mentoring and under sponsoring is one such aspect, because we are not able to recognize the subtle ways wherein gender equality has seeped into our systems. We've also not been, cognizant of the covertness of this problem. COVID has been another very big eye-opener, especially in gender-based roles. The way work and family life balance was disrupted. I think there was a survey that was done in TMC, Tata Memorial Hospital, which indicated that around 65% of women had additional responsibilities in comparison to 30 to 32% of men who had additional responsibilities during the COVID. And most of us felt that, at least in our part of the world, that men were not attuned to doing work at home. And that was surprising, but unfortunately we had to live through that. You know, solutions evolve when we can expand our own consciousness, come together and work on the oneness of experience. And I think that is what conferences like this really can initiate. The very important takeaway is for women to be less critical of each other and more supportive, and also kind of essay role models, bring about forums like this wherein these things can be promoted. Changes have been brought into the world, and they have been brought about by constantly working towards it. So I think that is important to get together for all these very important aspects of development. Secondly, I don't think it is to do with more like a feminist or a non-feminist thing. I think the hallmark of an evolved society is progressive men and empowered women. And the two of them working together for a more progressive growth environment is what one should really focus on. The last but not the least, just a very, very personal comment. As far as stereotypes are concerned, well, the biggest stereotype is that women are compassionate, nurturing, sentient beings. And I think the world needs to be exposed to more such stereotypes, and they need to come more in positions of making a change and of being voices that need to be heard. Thank you so much, Josie.
So thank you very much indeed. And may I request everyone to please on your camera so that we can have a common picture to record this, first GLOWS summit. And Priyanshi or Mayur, you can do the needful. Can we have all of you with on camera?
Hopefully we can meet very soon in person.
Yes, we all echo that.
Absolutely, absolutely. So can we have a, Mayur, can we have a setting wherein all can come into one frame?
Ma'am, you all are in one frame. I'm taking these snapshots.
Sure. So take 2-3 snapshots.
Yeah, sure, ma'am. Done, ma'am.
Thank you very much. And over to you, Priyanshi.
Thank you so much. Now, I would like Dr. Jyoti to give a vote of thanks. Thank you. Over to you, Dr. Jyoti Bajpai.
So towards the real end, and I'm truly, I would say that on behalf of my entire organizing team, I'm actually feeling very overwhelmed and humbled while expressing my formal, gratitude and sincere thanks towards each one of you to support this unique mission and summit, which is way beyond actually a summit alone, and actually a thought process, mission, and we need to take this momentum forward. The first edition of the summit GLOWS speaks to our commitment to fight one of the biggest challenges of our time, that is inequality, and an end to discrimination against women in science and oncology, no matter where they live or how they live, so that we leave no one behind. And I would say that I'm really grateful towards our chief guests, our esteemed directors, and for their progressive thoughts and support, our orator, Dr. Peters, our esteemed, overseas panelists, speakers, our national faculty members, the core organizing team, including Nabi and Mostafa, who has really worked with me very closely to make this summit a success. I'm really grateful to all of you, with the bottom of my heart. And also, I would like to thank our media partner, Humanity Talk, and Dr. Amelia, who provided us the stage and voice to circulate about the summit on Radio Africa. And last but not the least, my event team led by Rajesh Sharma, Mayur, and Priyanshi, who really supported the summit wholeheartedly. And essentially, this demonstrates that change is possible with strong leadership, and it underlines how important it is to have leaders who lead from the front. So each one of you actually come forward to support the summit. And I should say that this is the first summit, and this will be a repetitive event. So please mark your calendars today itself for next year's August 5, which is a Saturday, for the second edition of GLOWS. We will, in the due course of time, will confirm whether we will be able to do this in person, which we really, really want, or it will be in hybrid or virtual, depending upon the COVID situations. But we will certainly, continue to have this, summit each year. And with all of your support, also GLOWS has announced that we will be having a distant mentorship pool, which all of you wholeheartedly supported. So we will inform all of you in due course about that as well, and how we can benefit the mentees. We will be having a structured program in hand, which we will inform everyone. The other thing, we wanted to have International Women's Day, but we are trying to. So all of you supported the thought, and we are in talk with leading societies that which date, how it should come. With all that, we will inform you about International Women in Oncology Day soon. So thank you everyone again for your wholehearted support. Thank you very much.
Thank you, ma'am. So we had a wonderful out-of-the-box talks as well as panel discussions today, and I'm sure it will positively change in the working environment in oncology all over the world. On behalf of the organizing committee, I would like to thank the eminent faculty members from world over for their time and valuable inputs. Also would like to thank the attendees who joined from different parts of the world and made this summit a great success. Thank you, everyone. Goodbye and take care.
Thank you, everyone. Thank you, GLT.
Thank you,
Bye,
everyone.
everyone.
We'll share the
Ciao.
picture very soon.